if what David said is true, that, you know, we're going to have to be passing them anyway, then let's not set targets. Just let them come in with whatever they want, because that's what's happening, David. I guess I'm just,
well,
I guess
I
I'm just
understand
getting a little,
Mr.
you
Chairman,
know,
I understand Councillor's frustration.
yeah.
You didn't see the original budget request that came in to us.
Oh, so it's even worse than ignoring our
well,
targets.
it's not worse. I wouldn't say better or worse. I'm saying they came in, and through discussions that we were able to help them position their budget as close as they felt was reasonable, given the pressures they're getting from their board, to what regional council would expect. So
Well,
I would suggest that the setting a target does give us a starting position in our discussions with them at the staff level.
Well, I would suggest that we tell them that their 2019 forecasts are totally wrong, and that we're not looking at those forecasts, we're looking at our targets that we give them. And I don't think it's going to mean a hill of beans to them at all, quite frankly. But, you know, putting in a forecast that it's going to go up by this amount is almost saying that that's what we expect them to bring in. And, you know, I mean, I've been on boards that have done budgets before, and you look at something like this, that, oh yeah, council knows that this is our forecast, so they're not going to work towards the target, they're going to work towards the forecast.
Councillor Gibson.
Thank you, Mr. Chair, and sorry about going back on, but Stephen, I think your answer to Councillor Sato confused things again, at least for me. What is the average person in Peel pay for regional taxes?
So I'm just going to pass this over to Norm, who has been quickly working on the numbers.
Yeah, hopefully I can explain this clearer using this slide. So when you see that the tax of 1889, that's the region's portion. So as Steve had mentioned earlier, that's actually 41% of the tax bill. So the full tax bill, property tax bill, is probably closer to about $4,600. So when we have an increase of $47, it's compared to the total property tax base. That $47 is, if you try to do the conversion, it's basically 2.6% net tax levy. So when you try to do the math, it comes out to $47. That's why it looks different. So 47 on 1889 looks strange because you're comparing apples and oranges. The total tax bill is closer to $4,600. So when we say there's a 47% or $47 increase as a result of our net tax levy of 2.6%, that's the $47. We divide it by the total property tax bill of $4,600, which is close to 1%.
Well, that makes it so much clearer.
Let me try that one more time.
No, I'm trying to break this down simply for people at home. So if somebody pays $2,000 to the region of Peel for their tax portion, because it's all broken down in their tax bill, what is their increase? If it's 1%.
2.6% on that,
Yes.
on the region's portion.
So it's 2.6%.
1% on the overall tax bill, 2.6% is a net levy increase on the region's portion of the bill.
So then this 1% is misleading. Because people are going to look at that and say, well, my tax increase at the region bill didn't go up 1%, it went up 2.6. So I don't know why we're portraying it as one. Because we don't know what the other municipalities are doing yet. Like, I don't want to mislead people. I want people to understand if they're paying $2,000, I'll just use that as an example. A lot of people pay a lot less than $2,000. I think I pay a lot less than $2,000. But that's just an example so people can understand when they get their bill, how much is it actually going to go up? And if we say 1%, that is totally wrong.
So as this slide shows, when we describe the overall tax impact, and when we add the region's portion plus what happens with education in the local portion, we're trying to work with the local municipality so that we can present an overall number that applies to the full tax bill of, say it's an average of $4,700, so that when you look at the region's portion with the local portion, you get an overall number that equates to something that's in line with inflation. So we're trying to keep it as simple that way. So when you add the region's portion to the local portion, that we get an all-in number that the resident would understand, because they see the bottom line impact.
But Stephen, we don't know what the local portions are going to be yet.
No, we don't know that yet. That's why we have the scenarios.
Can't do that. So all I want to make it simple. So if somebody pays $2,000 to the region right now, what are they gonna be paying after? To the region,
2.6% more.
2.6%,
Correct.
not 1%.
Correct.
Okay, so that 1% to me is misleading. And it should be made clear that it's 2.6% increase to the region appeal.
Mr. Chairman, if I may on that, so you're right, it's 2.6% on the regional portion of the tax bill. The region consumes 41% of the overall tax bill.
I understand.
So that 2.6% increase on the regional component, the regional portion of the pie, is the equivalent of a 1% increase overall. So if both the education and local municipalities stayed at zero, the overall tax for that family would go up 1%, even though the one component of that went up 2.6.
Still misleading to me, because the actual increase in their regional tax bill is gonna go up 2.6%. And then at the city, we're gonna have to explain what the city was. The difficulty we have here, and we understand it, I'm not sure a lot of people at home do, is we're a two-tier government. Where Toronto and other municipalities, I think Hamilton, there's a few of them in there, are one tier. They can deal with everything at once, and at the end of the day, say, your taxes have gone up 3%, 2%, 1%, whatever it is. We have to deal with three things, including the education portion of it, when the city sends out the tax bill. Regional doesn't send out the tax bill. As regional councillors, we don't get calls necessarily. It's more as city councillors we do. And then, of course, Brampton and Caledon have city councillors at home that don't know what we're doing here necessarily. So I just want to make that clear, because when I asked the question originally, I thought out of 2,000 it would be 20, and you said yes, and it's not. So I don't want anybody to be misled. It's 2.6%. The region portion is going to go up, and then when we get to the municipalities, we'll have a closer view of determining what their overall tax bill is going to be at the end of the day. Is that a fair assessment?
Correct, and that's what this slide is trying to show,
Okay.
the decisions that council will have to make at the
Right.
local level to come up with that overall number.
Okay, thank you.
Yeah, Mr. Chairman, I think it's a really important point that Councillor Gibson is raising. If you look at this chart at the local municipal increase, say just for sake of example, the local municipality decides on a 3% increase in their levy, which is which will be the equivalent, not the equivalent, but, you know, so the region's had a 2.6% increase in its levy. The city's had a 3% increase. What the taxpayer sees when you put those together is a 2.2 overall increase in their tax bill.
Correct.
So, yes, the component parts have gone up more than the overall total. But because of the way they're shared, the overall total stays at 2.2% in that example. And that's, you know, in working closely with the municipalities, that's what we've been trying to focus on.
Yeah. And I know at least in Brampton, what we try to do at the end of the day, because we finally make our decision, it's really the final thing that happens with your overall tax bill, is explain to people that we are not a one-tier government where we can deal with it all, and here's how we break it down. I remember when we first got on council, it wasn't broken down like it is today. It really wasn't. It was just, here's your taxes, and then you got all these calls and had to explain to people, well, hang on, we got education. And back then, the education was always higher than anything else, but we were getting blamed for it. We had no say in it. We had no say at the regional level either as a municipality. The regional councillors sat there, but, okay, I hope that makes it a little bit clearer. Thank you very much.
Thank you. Mayor Jeffrey.
Thank you, Stephen. I wasn't going to wade into the external agencies because I think we're going to have a more fulsome discussion on the 16th. But I just want to perhaps provide a little balance to the conversation about Peel Regional Police. 93% of the budget is salaries. And 3 members of a 7-member board who are elected officials who sit around this table recommended to the chief that they come in at higher than the target. So you'll hear more about those details when Chief Evans is here on the 16th, and see if you come to the same conclusion that 3 elected officials were prepared to support. So, Stephen, I wanted to ask you about, so first of all, I agree with Councillor Raz. I really like the way this was set up. I think it's easier to read, it's easier to follow. I really liked the service pressures component, which I think I'd love to find a way to put in our budgets as well at the City of Brampton, because I think that we talk about them all the time, but I don't think the public understands some of the constraints that whether it's legislation or other pressures with regards to contracts that really determine where we have to go. So I really like that. I like the mitigation highlights. As I was reading through the budget, I had a question, and I did pass it on to David Schwark, and then I think I'm going to get a report on it, but I didn't know about the Lean Six Sigma methodology that you've been using, and I understand you've used it before, whether it was on direct childcare or whether it was water testing. Can you think of anything that you've used some of that efficiency programming this year that we can point to? Because I think it gives confidence to certainly our business community that we're thinking like a business. We're trying to determine what lines we should still be in and how that has filtered through the organization.
Certainly.
Sorry to put you on the spot, but I thought it was really
I do
helpful.
have a copy of the report that went to Council on October 12th where we outlined the savings. And as I noted in the slides, the total savings were $3.2 million and the cost avoidance of another $4.2 million. But some of the areas that we explored during the past year and a half or so, some initiatives around income support. I'm just looking for the more detailed version so I can provide a little bit more fulsome example. In income support, the benefits realized, we're using technology to deliver e-training courses, which reduce the number of classroom hours from 1,500 to 420 hours, resulting in a cost avoidance of $55,000. So using technology to deliver training services differently, and we are doing that throughout the organization. So that's one example, and maybe I'll just give you another one just to give a bit of a sense. In housing support, again, technology is a driver. So improved application process for clients, introducing self-service applications so the client can access the service 24/7 anytime without having to wait for somebody to serve them in person to person if they don't need to have that level of service. Again, these are the types of things that are being done looking at our process improvement opportunities. We adopted the Lean Six Sigma approach more formally in 2016, so we're starting to see that reap those benefits in a more deliberate way. But we also do things around program evaluation, particularly in health services, to make sure our services that we're delivering are actually having the desired impact. There's no sense delivering process improving a service that's not having the desired impact. We look at service delivery model changes. So the lab service was an example of something that we did in 2015 or so, where we outsourced that service delivery. We also did an evaluation of our childcare services about 4 years ago now, I guess, and we're reaping the savings. Not only that, there's no children left on the wait list as a result of that decision of council.
Thank you.
David, did you have something to add to
Just a couple of other examples, notable examples. One was the work that we did using Lean Six Sigma methodology with the hospitals to reduce the patient offload time significantly. That, along with the additional funding for offload nurses from the provincial government, had a noticeable and quite dramatic reduction in offload delay. And we are now using that same methodology, working with the paramedics again, looking at our crew scheduling methodology, because we're finding we're spending an inordinate amount of time trying to match people who are available to work to getting them on the right shifts. So over time, it's become sort of a cultural, internal cultural approach to how we do business.
And providing better customer service.
Yes.
Thank you. Thank you very much.
Thank you. Councillor Yanika.
Thank you, Mr. Chair. I'm going to stand for this one because it came up last year, and I'm going to wear my CVC hat. And it wasn't Councillor Sato that raised it last time, but with the greatest of respect, I want to correct some of the misunderstanding as it relates to those types of budgets. But Pat, it wasn't you this time. It was somebody else that asked. This time it's you. So here's what I'm going to have to explain that's somewhat misunderstood. We are confusing mill rate with expenditures and with revenues and recoveries. So we have the privilege, unlike the CVC, that we have a certain mill rate, but our expenditures may be fundamentally different than our mill rate because you have other recoveries. Like the water bill, you're raising 6%. So to tell someone, your mill rate's only going up this, but hold on, I got a water bill that's doing this. Let me take you back down to the local level. And when you get on a bus, you're paying me a dime more. And when you take your archery class, you're paying $50 more for the program. The CVC can't do that. I don't have those other recoveries. The police can't do that. Say, we've arrested you and we're charging you $200 for the effort. They have to collect all of their revenues from us, by and large. But here's the fallacy, Pat, and I'll prove it to you this way. And this makes me express it very, very simply, that I hope it never comes up again. Pat, you and I sat on a council that for 12 years does not raise the mill rate. But if a taxpayer would have said to you, well, it's 1990, Councillor, and you haven't raised the mill rate, and it's 2002, you're spending what you spent 12 years ago. Absolutely not. Our budget doubled because of the other recoveries. Whether you raised levies, whether you had other sources of income, whether user fees increased, whether the Conservation Board does not do that. If you compare us, and this is the point that Miranet makes every year to us, you may be talking about this mill rate. On our side, $496 million we collect from all taxpayers. That's not what we spend a year. What are you charging businesses? What are you charging transit users? So your expenditure model is going up 5 or 6 or 7%, not unlike the CVC. It's a bigger problem, but for those agencies like the CVC that don't have the, I can't raise your water rate over here and keep you at 1% here. I can't charge you more to get on the bus over here. When you look at the totality, you will see many of those other agencies, including the CVC, on your overall expenditure are very much in line with the rest of the agencies. Thank you.
Thank you. Councillor Fonseca.
Thank you, through you, Mr. Chair. Thank you very much, Stephen, for the presentation. I too want to just say thank you for the way, and to all the staff time that's gone into the way that this budget has been presented, but also at the request of council to have the presentation and the budget binders presented earlier. To Councillor Gibson's point, so when you look at slide 43, down at the bottom, it says assumptions, Peel 41%, 2.6, education 19, then the local 40% with 3%, depending on the municipality, the increases. Perhaps that could somehow be reflected in a picture. So you have the 1% here, but perhaps the assumptions need to be reflected also somehow in a
We can certainly take a look at how we do that.
Because it is explaining to residents, it is very difficult inevitably to explain to residents the two-tier, and perhaps if that was explained in a picture format with a number breakdown, that might be a better way to be able to explain it to residents.
Yeah. Mr. Chairman, if I may, the other thing that we've been doing over the last number of years is also detailing in our information about the budget what that increase is buying, if you like. What has changed? How many more increase in paramedic deliveries, calls, and so on. So it's not looking at the increase is only looking at one side of the equation. The increase also, we're also providing additional services and investments. And in fact, if we took out the 1% tax levy and we took out all growth in services, in other words, we didn't meet demand, the budget would actually go down this year over last year. The reason it's going up is because we are adding services because of 50 people a day coming into Peel. So we try to explain that as well. But unless you use those services every day, it's difficult, I think, for some people to understand.
Definitely, very difficult. But I know that through this budget, that's it, tying the actual budget and linking it to strategic plan and the services provided through Living, Thriving, Leading is what you've tried to do. I think the slide, state of good repair, DC funded and non-DC funded counts priorities is extremely important as well to use in conjunction. I was going to reference the importance of the lean with the paramedics, but that's already been discussed. So I just wanted to mention the the slide here, but also to Councillor Sato's point, and then what was raised with regards to the external agencies. I do think it's important that we have a target for them, but then that allows for conversations with them at an earlier stage. I know that in the last term of council, to what Councillor Sato was saying, I believe it was Councillor Mullen that raised, not only with police services, but with the conservation authorities, we were able to meet with them. It was a committee, and we were able to meet with them as well as staff earlier on, prior to, even long prior to them coming to do their budget presentation. I forget what the committee was called, but that was very helpful in determining are there ways that we can work with them to get that number down to meet the council priority number for the external budget. So I don't remember what that committee was called with the conservation authorities, but I think that was helpful. And I think even with police services board, if there are elected officials on that board, but once we hear their presentation at the next budget meeting, if we're able to, Mayor Jeffrey mentioned a lot of it is labor costs, but if we're able to then respectfully suggest they go back and look if there are other aspects of their budget, their 2019 proposed targets that they're able to address, if that's possible. I don't know if that would require a motion, or if we're able to give those agencies direction. I don't know if that's possible. But I know that with the conservation authorities, that was what I think in our last term of council, what led to the conservation authorities working with staff and the councillors that are on those boards, working through how they could potentially address kind of that gap between what they were presenting as their external budget with what our targets were. Thanks.
Okay, thank you. Councillor Starr.
Yeah, just as a point of clarification, I think I saw a chart, whether it was last year or year before, is the population growth in the region of Peel and the numbers that were given by the economist, I think 50 or whatever per day growing. And I thought it was higher. Does that include, is that just new arrivals, or does that include births?
That's the net population increase.
Net increase.
So it includes people moving out of Peel, people moving into Peel, plus births.
Okay. Is it possible, and I'm sure you have that, to see what the pattern was or the numbers on, say, for the last 5 or 10 years, and what your projection is for the next? I mean, it's probably just a very simple chart to say, here's what's happened in the last 10 years, numbers overall, net numbers, and what we think the net numbers are going to be over the next 10 years. I don't need it today or anything.
We'll certainly work with staff to see if we can pull that together for you.
Yeah, we can, Mr. Chairman, through you to Councillor Starr, this census, past census period, we've been growing at a rate of 20,000 a year. The 5 years before that, it was at 27,000 per year. 5 years before that, it was 30,000 per year, and 5 years before that, it was 35,000 a year. So the rate, you're absolutely right, the rate of increase is declining. But it's still significant, and we can get you the details.
Yes, I remember that because I did the calculations, and I used that number a few years ago, that it was 79 per day, and whatever it was. And I just want to clarify that that's the net number.
And that was the previous census period that David.
When you wake up tomorrow, is 54.5. Anyway, thank you.
Thank you.
Thank you. Councillor Groves.
Just a quick question with respect to the 50 persons or people per day. I remember Mayor McCallion always raised this around this table, and I don't think we've had anything done about it. I don't know who's supposed to do anything about it anyway, if it's the federal government or the provincial government, I don't know. But one of the things she raised, and it is, and I think it's still a problem, is we've got new immigrants coming into the country every year, and then a lot of them will settle in different places, Quebec and wherever. They get the funding, and then they leave, and they come here. Let's say they come to Peel Region. we don't get any of that funding that's provided, I think, by the federal government to Quebec or wherever they go before they come to Peel Region. We're actually paying for services. I don't think we've ever had anything resolved on that issue, and a lot of that is driving a lot of this stuff that you're seeing in the budget. It's driving the increases up. So what are we doing about it? I mean, we hear around the table, we have a $26 million shortfall. We're hearing from Steve that these sorts of things, these 20,000 people a day, or a year, let's say, part of it is that. That's a problem. Who's going to give us the money for that?
So, through you, Mr. Chairman, I think that of the increase in population, about 68% are attributable to direct immigration from outside of Canada into Peel. The balance is births and then in and out migration. And in fact, I believe our birth rate in Peel is around 17,000 live births a year, and it's higher than the provincial average. The issue of federal funding for immigration settlement, you're absolutely right, has been one that we struggled with for many, many years. As far as I know, nothing has significantly changed recently, but I don't know if the immigration patterns have changed. You're right, where people would come to one part. Our sense is that people are coming from outside of Canada directly to Peel because that's where there are now established communities within Peel. And they move to those communities. And the latest census data we've just got on immigration, so we should be able to break that down and report back to council with details on that and see if we can also track federal funding. And remember, the federal funding is a result of negotiation between the province and the feds. So it's a long way of saying, we'll bring it back to you.
And I hear what you're saying, David, and you know what, 68% is still high. Like, at 68% is, that comes straight into Peel. And then it drives the cost of the services we're providing, garbage, social services, health, whatever it is, it drives that cost up. So I've been sitting here hearing this argument for years and years and years, and really, I haven't seen anything coming back to say the feds are stepping up to the plate and they're giving Peel more money to address the 68% of the cost that immigration's bringing. So I'm going to wait for
Okay,
that to come back.
Mr. Chairman, there's really 2 points to this.
It
One
is.
is the importance of immigration to Canada for our labor force. Because if you remember, due to the slides, we are getting older, and even though in Peel we are reproducing rabbit-like, Canada as a whole is not. And therefore, we do need to replace our labor market in order to sustain ourselves in the future. The question is, as people come in without primarily language skills, what are the implications to the local communities to help
Right.
them integrate?
Right, and I have no issues with that, David, and I understand that we need the immigrant population for the labor market. I'm an immigrant, but you know what? The problem is that we have this, and the feds are not stepping up to the plate to help us fund and provide the services. You know, the labor market thing is fine, that's fine, but we need the funding. We keep saying here at this table, the province needs to step up, the feds need to step up, and that's all I'm saying. I don't want to get into all the other stuff, but it's the funding. So I'll wait, well, I guess when the report comes back. Thank you.
Janice, did you want to make a comment?
Yes, thank you. Just a minor one through the chair. You did mention social services, and I wanted to remind council, and I will talk about this in my presentation, that 100% of the cost of Ontario Works is now with the province. So when new Canadians do happen to end up on Ontario Works, it's covered by the province.
Well, that exhausts the list there, Steve. I see you didn't lose any more hairs. No. Okay, that brings us to Commissioner Polsinelli, Commissioner of Health Services. Welcome, Nancy.
Thank you. I didn't wear the right dress. Okay. I am pleased to be the first commissioner to present detailed budgets to you today. As both David and Steve noted, this year's budget is divided into the services we deliver. I will be highlighting 6 services in my area. 3 of these services fall within our council-approved strategic mandate for living. The other 3, the ones you recognize as part of public health, fall within our thriving mandate. And with me is Daniela Samuelewski, our health, Samuelewski, I did it right. She wrote it phonetically for me. Health Services Finance Manager. So I will start with paramedic services. Paramedic services embodies the living area of focus. We help people during extreme times of need and provide expert, reliable, pre-hospital care. The cumulative impact of population growth and an aging population have a significant impact on the service demands in paramedic services. Deployment challenges related to provincial dispatch also stress our system. Right now, 25% of our calls are for patients 65 years or older. In 20 years' time, this same age group will account for 40% of the calls and trips to hospital. And the complexity of our calls continues to increase. Dispatch reform is critical. Almost 3/4 of our current calls are dispatched as lights and sirens or life-threatening. Yet, as you can see from the slide, just 1 of our 5 most common medical issues, and that's respiratory distress, is considered life-threatening. Our paramedic services continues to be world-class in the care it provides our community. The focus on both medical innovations that help save lives and supports for those who do the saving. The system can only be good as the people who deliver that service. Our focus on wellness, both health and safety, as well as mental wellness, is a joint collaboration with the union. Together, we need to help our staff deal with the traumatic events they see and experience every day, and make sure that they have the right tools to deal with the complex population that we serve. Continuous quality improvements are central to how we work. And here are some examples of where we recently found efficiencies. Our divisional model has allowed us to change the way we manage inventory. Our logistics team has introduced new centralized practices for all reporting stations. This centralization has helped us to save $500,000 through improved management of medical supplies. Collaborative work with paramedics on joint health and safety issues has resulted in reduced need for modified work. We have reduced our 2018 budget by $300,000 as a result. This year, Peel paramedics will have seen 6,000 more calls than the year before, and we forecast at least the same increase in 2018. We recommend an increase to the 2018 paramedic budget to address the ever-increasing gap between the number of calls we receive and their complexity and the growth of our population. This increase will help us to achieve the response times approved by Council on September 14th. We recommend an overall increase of 23.25 FTEs. This includes 19 paramedics, as well as support staff to supervise and train staff and manage our facilities. We need the equivalent of 2 fully stocked 24/7 ambulances to meet demand. The net annual budget for paramedic services, which is cost shared 50-50 with the province, is $51.8 million. As you can see, the increase in FTEs to address increased call volumes and complexity has been partially offset by increased subsidies from the province, as well as the internal efficiencies I've mentioned earlier. We are also recommending $5.6 million in capital for paramedic services. As I mentioned earlier, $1.6 million of this total is designated for new vehicles and associated equipment. The remaining $4 million is allocated for the replacement of vehicles and equipment that are at the end of their useful life. This slide summarizes the overall 2018 Peel Paramedic Services budget recommendations to Regional Council, as well as forecasts for our 3-year outlook. The next service highlighted is long-term care. We improve the lives of those with the most complex needs, including advanced dementia, and we use innovative, person-centered approaches to support their clinical, physical, social, and psychological needs. Council's ongoing commitment to the recommendations of the Aging Population Steering Committee means that our 5 long-term care centers fill the gap in the system that are not being met by private and nonprofit centers. When our residents come to live with us, they already have complex health issues. They have more complex illnesses than ever before. Many have 3 or more, and 2/3 of those have dementia. More than 4 in every 5 residents are highly or completely dependent on staff to complete daily tasks. This includes feeding, toileting, dressing, and everything you and I take for granted every single day. And much of this intensive, personalized care requires 2 staff members working side by side to complete it. We focus on medical and care innovations that truly improve the lives of our residents when they are most vulnerable. We continue to achieve and surpass high industry standards for the quality of care we provide. Our focus on person-centered care, which is highlighted in our Butterfly pilot at Malton Village, is already starting to bring the emotional needs of our residents into balance with our traditional priorities on clinical needs and physical security. We will be bringing a completed evaluation of the Butterfly project to Council this spring. Here are some examples of the kinds of work we are doing to find continuous improvement efficiencies while improving care. We have strengthened our admissions process to help new residents and their families better cope with the emotional impacts of transitioning into long-term care. And collaborations with public health and our pharmacy provider have improved resident safety. We recommend an increase to the 2018 long-term care budget to manage the increased frailty of our residents, shown in red in the graph, and the demand for specialized services like dementia care, shown in blue. As I mentioned earlier, the intensive personalized care we deliver must often be done by 2 members working side by side. To support the increasing demands, we are recommending 1.5 FTE for registered practical nurses to work on the first floor of Peel Manor to address these issues. And this will help us improve the staff-to-resident ratio at Peel Manor so it matches other centers, manage the increasing medical complexity of our current and future residents, and prepare us to move to the council-approved Health and Wellness Village at Peel Manor. The net annual budget for long-term care is $34.1 million. The net increase in this budget is largely driven by inflationary pressures and increased service demands because of the complex requirements of our frail residents. The increase has been partially offset by an anticipated subsidy increase from the ministry, as well as significant rate reductions in hydro. We also recommend $4.1 million in capital. All capital investments are allocated for work at the Davis Centre, Malton Village, Sheridan Villa, and Tall Pines. No new investments are designated for Peel Manor as we prepare to move into redevelopment. Of the $4.1 million recommendation, $0.3 million is designated for equipment repair, and the remaining $3.8 million is allocated for major facility maintenance. This slide summarizes the overall 2018 long-term care budget recommendations to Regional Council, as well as forecasts for our 3-year outlook. The next service highlighted is Adult Day Services. Adult Day Services, offered at each of our 5 long-term care centers, provide a critical community service for those frail seniors still living in the community. Our services help maintain their well-being and stay in their homes rather than being admitted to hospital or long-term care. And we give caregivers much-needed respite, sometimes for an hour, sometimes for a day. The complex care needs of our aging population doesn't just impact long-term care. They stress our adult day services too. In fact, today's adult day service participants would have been long-term care residents just a few short years ago. Today, 3 in every 5 require intensive supports of daily living, like bathing, personal care, and physiotherapy. And more have been diagnosed with dementia. We operate at 100% capacity every day, and the wait list for services continues to grow. Just like in long-term care, person-centered care is the focal point of our adult day programming. It is central to our planning program expansion at the Seniors Health and Wellness Village at Peel Manor, and it supports the emotional, physical, social, and therapeutic needs of our current and future participants. The net annual budget for adult day services is $2.2 million. Like long-term care, the net increase in this budget is largely driven by inflationary pressures and increased service demands because of the complex requirements of our frail participants. There are no offsets, and there continues to be pressure due to funding shortfalls from the LHIN. The net annual budget for adult day services is $2.2 million. Again, like long-term care, inflationary pressures and increased service demands due to the complex requirements of our frail participants drives the net increase in this budget. Unfortunately, permanent funding from the LHIN received in 2017 has not kept pace with the changing service demands. As we outlined in our January 19th report to the Health Service Integration Committee, the LHINs have not provided inflationary increases, and the funding for adult day services remains at the 2012 level. My first 3 presentations focused on the living area of the strategic plan. Now I will focus on the 3 services that support the area of thriving. These 3 services connect to public health. Healthcare is the biggest driver on the provincial budget. As you know, treatment is far more expensive than prevention. These costs are driven by both population growth and the aging of our population. The goal, our goal, is prevention. We want to help our residents truly thrive, to live longer, better, in their own communities, and in doing so, reduce the burden of chronic illness on our healthcare system. More people are living longer, but their quality of life is impaired. I just mentioned the pressure that chronic illness is placing on our long-term care and adult day services. The prevention of chronic illnesses such as diabetes, overweight and obesity, cardiovascular and lung disease, and oral health improve the health of our population as a whole. Further, our policy work is extensive. Not only does our smoke-free workplace policy protect more than 6,000 regional employees from secondhand smoke, but also every citizen who visits a regional site. An ounce of prevention is really worth a pound of cure. As Council knows, the power of public health's disease prevention activities is realized when we view the work over time. Many of the benefits for the Peel population are realized in decades, not months or even years. We focus on safe use of substances, healthy eating, active living, being tobacco-free, and building healthy communities. As you've heard in my previous presentations, continuous quality improvement is central to our work. We improve the way we offer oral health services to reach more of our most vulnerable children. We changed our service delivery model, streamlined administration, and extended clinic hours, and these saw dramatic results. We recommend an increase to the 2018 chronic disease prevention budget to manage the complex needs of our aging citizens, specifically those with oral health issues. On April 27th, Council approved a $200,000 increase for our seniors dental program. So seniors that have received dentures through the program can return to have those dentures adjusted and refit after they've worn them for a while. The net annual budget for chronic disease services is $12.1 million. Inflationary impacts have been offset by increases in anticipated funding from the province. This slide summarizes the overall 2018 chronic disease services budget, recommendations to Regional Council, as well as our 3-year outlook. There are several external factors that may influence these numbers and those in the next 2 presentations. They have not been included in our calculations. First, we still have not received this year's funding for public health programs from the ministry. The 2018 budget, as you see here, assumes we will receive funding as estimated for 2017. Second, the financial impacts of the province's new public health standards for our programs and services has not been included in either the 2018 budget or the outlook years. We will update Council once we understand the impact of changes expected in the new year. Infectious disease prevention is the second of 3 service areas that connect to public health. Population growth is a key driver in this area. More people mean more risk of infection from vaccine-preventable diseases, foodborne illnesses, and sexually transmitted infections. Vigilant health protection saves lives, and public health delivers these services every day. Protecting health is challenging, especially in a community that is growing at such a remarkable rate. Every food service location in Peel was inspected based on risk, with those locations with the highest risk for foodborne illnesses being inspected at least 3 times each year. This continues to encourage a high level of compliance across the region. Close to 20,000 residents have visited one of our sexual health clinics for free testing and treatment to prevent the spread of sexual transmitted infections. Our infection prevention services are mandated by the province. We focus on maintaining high standards and compliance levels in all areas of infectious disease prevention, including distribution of vaccines, surveillance of health status and policy development, as well as inspections of clinics. We also create a safety net for the health of the most vulnerable members of the Peel community through our close work with hospitals, long-term cares, and other medical settings, and through our own programs, including tuberculosis monitoring, needle exchange, and tattoo parlor inspections. We recommend an increase to the 2018 infectious disease prevention budget to address the opioid issues with harm reduction support. Between 2012 and 2016, we saw a 183% increase in the number of client interactions and a 334% increase in the number of clean needles distributed through our harm reduction program. And while the number of deaths due to opioid overdose is lower in Peel than in our neighboring jurisdictions, we have still seen the number of confirmed opioid-related overdose deaths double every year since 2013. As Council endorsed on October 12th, we will expand the reach and service hours of our needle exchange programming through the addition of a second mobile van. This will allow us to reach different communities at the same time and expand our operational hours to nights and weekends. The net annual 2018 budget for infectious disease prevention is $9.6 million. Increases in funding from the Ministry of Health and Long-Term Care for local opioid response will partially offset the increase in base funding. Public Health will be requesting an additional $37,000 from the province for needle exchange supplies. We are recommending an additional $215,000 in ongoing annual funding from Council for the remainder of these program costs. We are also recommending a capital budget increase of $700,000 for an information management system. The system currently supporting our food premise and personal settings inspection program is obsolete and must be replaced by early 2019. This slide summarizes the overall 2018 infectious disease prevention budget recommendations to Regional Council, as well as three-year outlook. As in the previous presentation, there are external factors that may influence these numbers and have not been included in our calculations. The opioid issue is evolving quickly, and our 2018 budget reflects only those changes tied to confirmed provincial funding announcements. Early growth and development is the third service area connected to public health. It also bridges into human services. Helping children achieve their potential and thrive is the responsibility of both our departments. Like many of our services, population growth is the key driver in this area. The population may be aging, but our number of live births relative to our population continues to be higher in Peel than in Ontario as a whole. Access to early support, especially for health and childcare, should be available to all Peel children, not just those with resources. Preparing children to enter school is challenging, especially in a community that is growing at such a remarkable rate. 3 in every 10 children in grade 1 are behind in at least one healthy child development measure. Programs focusing on reading and physical literacy help children get ready to go to school. We focus on the best available evidence on nutrition, healthy growth and development, and healthy environments to improve child health outcomes. We also collaborate with early years community partners to design and deliver specialized, universally accessible early years programs that meet the needs of our community. And together with partners, we have dramatically increased access to licensed childcare for children with special needs through the PEERS program. On October 27th, the Human Services team brought forward a report on the transition to the new Ontario Early Years Child and Family Centres in Peel. As a reminder, the province has downloaded responsibility for the oversight of these centres to the region to ensure consistency for all program users. This download is the driver for the 2018 budget recommendation. We require 6 additional FTEs to manage the work associated with the early years integration. The cost of these positions is $700,000, but the net impact to the region is 0 because these positions are fully funded by the province. The net annual budget for early growth and development is $14.7 million. Additional funding from the province has offset inflationary increases on this budget. We recommend a capital budget increase of $1.2 million for a funds management system. This system will serve both internal and external stakeholders and make our service delivery work as a child care system manager more efficient and effective. This slide summarizes the overall 2018 early growth and development budget recommendations to Regional Council, as well as three-year outlook. As a result of funding assumptions, it is expected that this service will not have a significant impact on the tax base over the next 3 years. This summarizes the 2018 budget recommendations for the 6 services that I presented. Thank you for your interest and attention, and I am pleased to take your questions.
And there'll be a few. Thanks, Nancy.
Thank you.
Councillor Moore.
Thank you, Mr. Chairman. I don't have any questions specifically. I would like to move receipt of the presentation. I'm not sure what process we're following. You're shaking your head no. I don't need to move receipt. I was going to move it in principle.
No, we'll do the moving the entire budget at once. We're not going to be moving individual pieces as we go along.
Okay, well, I do want to make some comments. It's interesting that this morning we had the presentation from Judith McWhinney that talked about the changing trends in the region of Peel, but also nationally and provincially. And David, in his introductory comments, talked about a budget of adaptation and the need for, in many cases, the human touch. And I don't think that any of all the budgets at the region, it's more evident that adaptation and the human touch are within health services and certainly cross over into human services as well, because technology cannot replace paramedics. It can help them do their job better. Technology cannot help with assisting with our patients or our residents in long-term care. So I think that you've brought forward an incredibly responsible budget, given the changing trends within the region and some of the realities that we're faced. And, you know, I, on a personal note, want to thank you very much. And I know I'm pretty confident I speak for Councillor Gibson. It has been a really seamless transition from Jeanette Smith as the Commissioner to Nancy Polsinelli. You know, we thought we were going to have to teach you a few things, but apparently we didn't. No, I don't think so. No, no offense to Jeanette. She knows that. She knows that entirely. But it really has been a pleasure working with you. And now the good thing about going first is that you get to sit and relax now while the rest of them sit there with the butterflies in their tummy, wondering what questions are going to be directed at them. But I want to thank you very much.
Thank you, Councillor Moore.
And I couldn't agree with you more, Councillor Moore. Councillor Raz.
Thank you very much, Mr. Chair, and thank you, Nancy. And we had a chat the other day. So I do as well also think that this is very responsible, and the fact that you were able to account for, you know, over 23 paramedics, but still keep the rate to 2.1% is very reasonable. What was a little bit disconcerting is the type of calls that the paramedics are getting in terms of the top 5 aren't really considered life-threatening. Are we going to have to undertake an education of some sort to try to educate people on when they should be calling an ambulance? I know it's very basic, but I would be concerned that it's being overused, or perhaps people are thinking that they may actually be able to get better access quicker in the hospitals because we know that the hospitals are having issues as well with overcrowding. So if they think they go in by ambulance, they may be able to jump the queue. Do you have any comments on that?
So through you, Chair Dale, and I know I have Chief Dundas in the audience, but I'm going to take a stab at this. Okay. Your question about education is a good one. It's a big behavior change that we would have to do for the entire community. One area that we're focusing on is the advocacy that's been endorsed by Council, and that is dispatch reform. So part of the issue is how the calls are made, or how the calls are sent out to our paramedics through our Mississauga dispatch center. with dispatch reform, that is looking at a different type of a triage tool. So those calls that are life-threatening will truly be life-threatening, and they'll be able to tier the calls based on the severity of that call. Right now, most calls, up to 70% of our calls, are life-threatening. On average, 10 to 20% are actually life-threatening that need to be transported to hospital. So through dispatch reform, and we hope to see some outcomes with the province in 2018, some of those challenges should be mitigated.
Okay, thank you for that. Do you have any sense, I don't know if it was included in the capital budget, when the Lorne Park Paramedic Station is going to be constructed?
2019.
Thank you. I can provide an update in my next newsletter. When it comes to the retirement of ambulances, we'll call them senior ambulances, what, are they on a set year schedule, or is it by kilometers? How are they taken out of service and new ones brought in?
For you, Chair Dale. I do know that an ambulance is usually fully in service for 7 years. That's usually the total time, because of the use, the ongoing use of those paramedics, not the paramedics, the trucks. I also know and can tell you that in the time of the useful life of our equipment, including our vehicles, the paramedics team is very rigorous around managing services, managing their preventative maintenance, ensuring that they're always set to where they need to be. Your question is a little more detailed, so what I'd like to do is, Chief Dundas, do you have anything to add to that? I did a good job. There you go. So yes, it is really about making sure that we are managing regular preventative maintenance schedule, that we are monitoring our work orders to analyze any specific issues, any requirements that are needed, and then we take them out of service. The other thing we do in paramedics is we will move trucks in and out of service to allow some downtime, repair, and then go back out. But it usually is 7 years.
Okay, thank you very much.
Thank you. Councillor Miles.
Thank you very much, Mr. Chairman and Nancy, for your presentation. I guess from my perspective, when I look at the big picture and then look at what we're doing in the region of Peel, I guess I feel like we should be doing more. So I certainly support your budget, and I think it's a responsible one. But my concern is more about how we are going to meet the needs of an aging population, especially if we're looking at 134% increase in people over the age of 65 over the next 20 years. So, and having said that, when I look at all the different service areas and the facts that you presented to us, every one of them is a conversation that I think we need to have and maybe have over the next year. It's amazing how quickly things change in our world. So the priorities that we set in our strategic plan, I think a lot of those need to be revisited. In the area of long-term care, I think the region of Peel is so much further ahead of the game than other private sector long-term care centers. It concerns me that we have put a cap on any more long-term care centers. I really think the model that we're going to have in the city of Brampton as we transition Peel Manor over to the new Peel Manor Center, we should be looking at one for Mississauga as well. But I do know that council has said we're going to cap that. But when you look at the stats, you look at the successes, you look at what we've been able to achieve, I think council needs to take another look at that decision, because the pressures are not going away, they're just getting greater. And for those of us who are dealing with aging parents, and certainly maybe in that growth of those over 65, we need to be concerned about the future. So that's one of the things that I would like to put a note on to take a look at in the future. I guess the other concern that I have when I look at this is this recommendation that has come out of the province of Ontario that wants to move public health to a separate agency. My first question is it just public health, or is it long-term care, paramedics, all of the services that fall under your umbrella?
It's public health only.
Public health
Yes.
only. But even in the area of public health, you can see how we as a region who are providing services in all of these areas have a handle on where resources need to go, whether it be in the areas of prevention because of the demand that we are seeing in other areas. I really think that the Region of Peel has to come out very loud and very vocal about that recommendation and the impact that that could have on our community. History has shown us when we give away the delivery of a social or of a human service to an agency that is not accountable to the public, their costs escalate very, very quickly. Because we know there's always a balance between service delivery and cost, and because we're accountable, we tend to measure the balance much more than others who are not accountable back to the taxpayer. So that is one I really think that we have to take a look at. And adult day services, if there is any way that we as a region could put more money into adult day services, I think we should look at that. The fact that it's people on a wait list to have an aging person put into a long-term care center, the wait list is very, very long, and it takes quite a long time. At least the adult day services are providing some relief and some support rather than having these senior citizens who are suffering from complex illnesses at home alone. It's at least providing that kind of support. So I would like to put a note somewhere as we go through this budget, if there is any way to increase funding for adult day services, I would like to see us take a look at that. So I'm not going to put a recommendation on the floor. I have no idea how much it needs to be or should be, or whether or not, does 100% of the funding from day services come from the province?
No, it doesn't.
No, it doesn't.
No, it doesn't come from the province.
So we're funding it?
Daniela, did you want to answer the details?
Okay, so if we upped our game on that particular one, could we count on provincial funding? Or is that something we have to apply and get approved?
If we look at where we are today, it would be, it wouldn't be from the province. At this point, it would be based on regional dollars.
Because we haven't had an increase
That's
since
right.
2012.
We haven't had an increase since 2012, and that we're not seeing any change through our lens or through the province.
Okay, so if I could, if we are going to ask for some reporting back, I would like to see a report come back on how we could do more for adult day services within the Region of Peel, where they would go, and how we would be able to facilitate that.
And through you, Chair Dale, if I could just add some comments, Councillor Miles. Two things. There continues to be advocacy endorsed by Council on the funding for home and community care, which will support initiatives such as the ones you're suggesting. Moving into 2018, we are going to commence a rigorous review of our senior services strategy for the Region of Peel. Through Regional Council, we have done some wonderful work around the Aging Population Steering Committee, which has really provided a strong foundation. And as you pointed out, it's time for us to look at the evidence and reevaluate where we, how we support seniors. So I look forward to bringing that report to you for your review and comments and endorsement, of course.
Great. Okay, well, thank you very much, Mr. Chairman.
Thank you. Councillor Starr.
Yeah, I'm going to go way back to the paramedics, and I know there was concern brought up previously in the last year or two with respect to the wait and the holding times, the transfer times, whatever at hospitals and medical facilities. Has there been any update on that? And the other question I'm going to ask is, which I didn't ask a year ago, is what is the length of time between the time of dispatch, trip to the hospital, staying with the patient, release, and then being available for redispatch? I'm not sure if I don't think you'll probably have that today, but I mean, this was brought up, I think, a couple of times, and yes, I think the answer was to Jim, we're trying to improve on that, and et cetera, but what's happening with that? Can we get an update?
Okay. So for the first question, through you, Chair Dale, Councillor Starr, I think what you're asking is about offload delay. So how, then correct me if I'm wrong, the length of time we have our paramedics sitting at the hospitals.
Right.
Is that okay? So offload delay is actually one of those lean methodology examples that was provided by David earlier on. So we continue to work with our hospital partners in decreasing our offload delay. It continues, however, to be an issue just because of the number of people that go to the ER. So we continue to work on offload delay, which is really important. Some other areas we're focusing on is the hospital nursing program. So through the province, we have funded opportunities for nursing staff to be at our local hospitals to support those patients so that they could release the paramedics to go off and to the next call. So that is part of helping us to reduce that offload delay, that time that our paramedics have to stay in hospital. And the other continues to be advocacy on the dispatch reform. We are very hopeful that through dispatch reform, that too will support the offload delay. But we continue to have offload delay. Now, if you'd like numbers, I'm happy to come back to you with some more detailed numbers. I don't have those with me right now.
I don't expect you to, but I'm just saying that I think the pressure has to be on because the example I brought up at least 2 years ago, where there was at least 3 vehicles, and the time I was sitting there waiting for the patient I was with was 5.5 hours, and there was at least 6 paramedics that already we were being friendly. I knew their names because they were there waiting to transfer. To me, that's ridiculous. There's got to be a better system. And I'd like to get numbers, and I'd like to be able to say, let's put some pressure on, because if the hospitals are saying, well, we can't accept them, then, we've got a real waste of talent sitting, at the bedside of somebody. So I would really like to have that pursued somehow, and either a report come back and say, okay, it is being improved, it is not being improved. Just to say what we're pursuing that doesn't give an answer. So if we can do something on that, I just think it's very, very important, because if we're adding 23 people to be hand-holding and sitting, is that the right dedication of resources? So anyway, I'll leave that with you. The other thing I want to bring up is on the early growth and development, where you mentioned the 6 FTEs are being added, and the provinces will be paying for this. Is that forever?
And through you, Chair Dale, for that question, I'm actually going to refer to Janice.
Thank you. Through the chair, I hate to use the expression forever, but it is our understanding that the province will continue to pay for those, will continue to provide stable funding, of which those 6 positions are being funded through.
How do you get that assurance? I mean, they can say, oh, but this year, and then we're responsible for 6 employees.
So we do sign agreements with the province, but they don't go into perpetuity. They do get renewed. So for the next couple of years, we have assurance through an agreement that we will receive the funding.
Next couple of years.
Right, for the term of the agreement.
What's the term of the agreement?
I think we're looking at the next 2 years for that agreement, but it's basically no different than any other program or agreement that we sign with the province. They make a commitment to us to provide the funding, and we sign biannual agreements.
Do we have examples where the province says we're not paying you anymore?
I think we have examples perhaps where the cost-sharing piece may have decreased as salaries and wages increase at the region or benefits increase. But I'm not aware of any examples. I'm looking at my colleagues where the province has backed out of a commitment to that extent.
Okay, maybe we can look into that. I'd appreciate that.
The risk has always been that the provincial funding doesn't keep up with inflation. That's the risk that we take.
Okay, thank you.
Mayor Jeffrey.
Three things. On the issue of dispatch reform, I would recommend we join forces with AMO because I know that they're already advocating on this. So I've heard it probably every month. I've been at an AMO board meeting. So I would say that they're very strongly advocating on this file, and it's across Ontario, so it isn't just specific to us. Secondly, the LIN funding you talked about being funded at a 2012 level. Is that due to the census data? Do you think that there's an opportunity based on the fact that we have some new census information? Will that help the LIN get more money and thus help us get more money? Do you have a sense of how it's calculated?
So through you, Chair Dale, that's a very good question. I don't have the answer to that one, though.
Okay.
Not here today. I'm not certain, Daniela, if you do. Could we get back to you on that?
Yeah, I think
question.
that it might be something that they have
Yeah.
no control over if it's, because I think we've all been using 2011 data, and if the new stuff is coming through, it may, it certainly will help us because it's
2016.
evidence-based funding
I'm happy to get
wherever
that
you
for
are
you.
in the province. Thirdly, when I did the Peel Manor tour, when the Premier was here, I was struck by how many volunteers were in the building. And I don't think that's ever captured in our budget, but boy, we have a lot of people who may come in with a spouse, but then if the spouse passes, they still keep coming every day. So that's a real benefit to us as a region to have those people. They're not there for a paycheck.
No.
They're there because they want to make a difference, and we're really lucky to have some of those passionate, thoughtful, dedicated volunteers that really help provide a good quality of life to our seniors. So I was very humbled by meeting some of them. They were terrific people. So thanks for the tour. Thank you, Chair.
Thank you. Councillor Palashi.
Thank you. Through you, Mr. Chair. Under the infectious disease program, the provincially mandated program, do we meet the provincial standard or do we exceed? And what funding is provided from the province for this program?
Through you, Chair Dale, I'm going to ask our MOH to answer that question.
Through the chair, so Public Health works very hard to meet the standard for provincial programs. And then in terms of the funding, for the different infectious disease budgets, it is largely 75% funded by the province, 25% municipal, although there are some small pockets that are 100% funded by the province as well.
Thank you. Over to the paramedic trucks and the life and the resale value. At the City of Brampton, our fire trucks, we keep them for, some trucks, we keep them for about 5 years. And we do that because it seems to be a better value for when we go to resale to a smaller municipality. Have we looked at the resale value of the paramedic trucks? And do we think that 7 years is that best investment, cash for your dollar, kind of bang for your buck?
So through you, Chair Dale, that is a very good question, Councillor Palashi, one I'm smart enough to refer back to Chief Dundas to answer.
Through you, Mr. Chair, and yes, the 7-year life cycle of the vehicles, the ministry funding templates tells us we have to keep our vehicles for 5 years to be able to get the 50/50. When we went to the... Can you hear me? The 50/50 funding is contingent on that for buying our vehicles on an amortized value. With our divisional model, we identified that the vehicles aren't running 24/7 any longer. So they go off on shift for 12 hours, and then they're shut down for 12 hours. So the engine hours have reduced dramatically on it. Mileage may not have. At the 5-year mark, our historical, when we were auctioning off the vehicles, we were getting very low value for the vehicles. Maybe, I'm looking to my friend Sean Hewitt up there who works with me on this, but it's around the $5,000 mark that we get on return for the vehicles. It's very low value. And we're still getting that same return in the last auction, I think, on vehicles that are at 7-year life. So, so it
makes some difference.
It doesn't really make much of a difference.
Okay. And then further to Councillor Starr, the offload delay, I would like to see more of a breakdown as per hospital. You know, in the city of Brampton, we have the busiest hospital in Canada, so I'd really like to see those numbers and then comparable to across the region.
Okay.
If and when that comes back.
Absolutely.
Thank you.
Thank you. Councillor Sprovieri.
Thank you, Mr. Chairman. Thank you, Nancy, for the presentation. Nancy, I believe in the past, I don't know whether it was provided through a report, but it showed the rate of autism was increasing at a quite drastic pace. Do you have that information in here in relation to the new you're asking for more licensed child care for children with special needs? You're asking for 6 additional, did you say?
So that, through you, Chair Dale, I do not have that information with me. I'm not certain if Janice, you do? No. Okay.
So you're asking for 6 new?
So the 6 new FTEs are for the download of, I'm just going to grab that information for you.
I'm sorry. Could you repeat the question, Councillor Sprovieri?
Yes, they ask for the additional assistance for children with special needs. What was the number you're asking for? How many more?
FTEs?
FTEs, yeah.
6.
6. And how many do you have presently in the system?
Is it for special needs, or you're talking about the download of the early years centers?
For the special needs.
Oh, so we're not asking for new staff in special needs.
So what are these 6 people, who are they for?
So they are for the transfer of responsibilities related to the Ontario Early Years Child Family Centres, which is a new piece of work for us that is coming from the province.
Oh, this is a new program then that
Yes.
we're taking on.
That's correct.
And up till now, the province has been doing this, and now we're
Up until now, the province has been managing this program, and now they are transferring it to the municipality and also raising the standards and looking for increased access to increased programming.
So then 6 people will meet the needs for this transfer of responsibility. So do any of the existing employees that work for the province, are they being transferred here to Peel, or are they?
No. No, these 6 employees will not work in the child care centers. These 6 employees will help us make that transfer over to the municipality. And it is basically a new piece of work for us. We're looking at increased access, increased programming. The system itself has been static for many years, no new funding increases. It hasn't addressed the areas of growth in the municipality. So we're basically redesigning the program as we roll it out.
Mm-hmm.
I apologize that I misunderstood your question.
Okay. No, the reason I ask is that I've seen a report where the rate of autism is really on the rise, and I thought maybe you would have that information. So us taking this responsibility, I guess we have no choice. We have to take it, but we may really be taking on a huge responsibility if the rate of autism is just on the rise as it has been in the last 10, 15 years.
So these programs are basically drop-in centers for parents and their families to bring their children, have playtime, be educated, provide a range of services to the community. They're not specifically focused on special needs, but there will be some special needs programming with them.
Okay, and I believe that Aaron Oaks provides that service. There's a new center that's going to be opening soon in Brampton at McVean and Castlemore. So it's a huge, I think it's 200,000 or 300,000 square feet facility, and I believe that that's what they'll be doing there.
So the region currently has what's known as resource consultants, and I actually thought that's what your question was related to. And these are staff that go out and work with licensed childcare providers to come up with individual program plans for children that have special needs, such as autism. So we do work with the licensed childcare providers currently to help them put those plans in place to address special needs children. That is not a new line of work for us.
Oh, I see. I understand. Okay. Now I get it. Thank you very much. Thank you, Nancy. Thank you, Mr. Chairman.
Thank you. Councilor McFadden.
Thank you, Mr. Chair. I just have a quick question for Chief Dundas. I know that because of the value of the ambulances after their life cycle, I know fire donates used and old trucks to third world countries. Have we considered that for our ambulances? You have? Okay, because well, that would have been, you know, nice to hear, only because I think it is a goodwill gesture and certainly something that people in other parts of the world benefit from, so thank you. Thanks.
Well, thank you. Thank you, Nancy, for your presentation. And I'm going to suggest we break for lunch and ask that you be back for 1 o'clock. Thank you. We'll reconvene. Janice?
Thank you. Chair and members of council, I am pleased to present 6 service areas from the Human Services Department. With me today is Carrie Bazzelli, Finance Manager for Human Services. I'll begin with housing support. Housing support is the service system manager for the region of Peel and leads service and program planning and management of housing with a focus on policy and service integration. The region works to achieve affordable, sustainable, and accessible housing stock. Our goal is that individuals and households demonstrate a positive improvement as a result of the housing options made available to them. There is increasing demand for affordable housing in Peel due to population growth, aging population, the changing nature of the employment market, an increase in precarious and part-time employment, the rising cost of housing, and the low vacancy rates for the private rental market. All of these factors are having an impact on our programs. There are currently over 350 affordable housing units under or soon to be under construction, some of which will be available for rent-up in 2018. And on average, there are 842 people taken off the housing wait list each year and placed into subsidized housing. There are a number of key areas of focus for housing services in 2018 which do not have new budget asks, including a provincially mandated update to the Peel Housing and Homelessness Plan, which will address all areas of the continuum and include tactical, tangible, and outcome-focused goals. We plan to complete this work in 2018, and it will inform our 2019 budget requests. We are also continuing to invest in capital to increase affordable housing stock over the next 10 years. We continue to find ways to operate efficiently and effectively. Here are just 3 examples of how we are adapting to do better. We are exploring third-party community partnerships and service delivery models for new housing development by building stronger relationships with the not-for-profit and private sectors. Our use of an innovative request for proposal process resulted in 2 new projects in 2017, the Brampton Bramalea Christian Fellowship at 92 units and Daniels in Mississauga at 174 units. Both of these projects will provide affordable housing for low-income households and units for middle-income earners. We applied for and were successful in receiving 100 portable subsidies for victims of domestic violence, which will help these applicants achieve safe and stable housing much quicker. And finally, we are reviewing the rent supplement program and looking at how we can better attract and retain landlords in such a hot rental market. Increasing affordable housing is a significant focus of our term of council priorities and strategic plan. And council previously recognized this when in 2016, the Ontario Works upload savings were directed to housing to address the needs of applicants on the centralized waitlist. In 2018, we are recommending that the $4.5 million in upload savings be contributed to the Housing Reserve to address our commitment to supporting the resident transition at Twin Pines. We will be working with the residents in 2018 to develop a transition plan that supports their unique circumstances. Discussions with the Peel Housing Corporation Board will inform the use of this funding. Putting this funding into a reserve allows for maximum flexibility to support our transition planning with the ultimate long-term goal at Twin Pines of building affordable units to address the needs of households on the centralized waitlist. Here you will see a breakdown of the base drivers of our proposed net budget, which includes our recommendation of $4.5 million in funding for the Twin Pines Resident Transition Plan, as I just outlined, and a base cost increase to maintain our programs and services for a total increase of $4.9 million. In 2018, there is a capital investment of $8.3 million to assist housing providers with capital work, ensuring that our affordable housing stock is kept in a state of good repair. There is also a small request for regional housing capital repairs. These capital investments are funded from internal housing reserves.
This slide summarizes the overall 2018 housing support budget recommendation as well as forecasts for outlook years based on current service levels. I'll now move on to homelessness. In this program area, we provide support to people who are homeless or at risk of homelessness through emergency and transitional shelters, mobile street outreach, eviction prevention funding, and help in finding permanent housing. We strive to assist the households experiencing homelessness to obtain and retain their housing, and to increase the percentage of households at risk of homelessness to remain housed. 14,861 individuals received assistance through regional shelters, including Cothbra, Peel Family Shelter, and Wilkinson, and 163 people were assisted through transitional housing in Peel, including Peel Youth Village, Angeles Place, and New Leaf. We are seeing pressures on the youth shelter system, with almost 600 youth visits in our emergency shelters between January and September of this year. Through our 2018 investments and ongoing services, we will continue to operate 4 emergency shelters in Brampton and Mississauga and 2 transitional housing facilities in Mississauga. Our shelters are opened and staffed 24/7. In addition, our support extends to the street through a responsive, mobile, multidisciplinary team that includes mental health and substance abuse support, harm reduction staff, and additional resources through Ontario Works. In 2018, we're investing to add capacity in our region's youth shelter in Brampton and in programs with other agencies to address shelter overflow and prevent homelessness. This includes increasing capacity at the Queen Street Youth Shelter location by 10 beds for a total of 40 beds. It also includes funding to add additional resources to external agencies who prevent homelessness, including an outreach worker, a family conciliation worker, weekend supervisors, and a trustee. It is important to note that these budget requests will all be managed through additional provincial Community Homelessness Prevention Initiative funding, also known as CHIPPE, and therefore have no net impact on the regional budget. This slide summarizes the overall homelessness support recommendation to Regional Council. As highlighted previously, increases in homelessness services and prevention activities are fully offset by provincial funding for a net increase to the budget of 0. This additional funding will also be able to cover additional inflationary costs of the program, resulting in an overall net decrease of $100,000. $330,000 is included in the 2018 capital plan for shelter state of good repair and continues on an annual basis in the 10-year capital plan. This slide summarizes the overall 2018 homelessness support budget recommendation and forecast. For 2020 and beyond, the future outlook for operating expenses is consistent with increases that are in the range of inflation. I'll now continue with income support. Income Support Services works to increase the income of our Ontario Works clients through accessing financial supports and benefits, as well as increasing the percentage of Ontario Works clients that exit the social assistance system due to independence. As discussed in the economic update, the changing nature of employment and increasing population growth is having impact on the number of income support areas, including Ontario Works caseloads, discretionary benefits, and other financial supports. In 2017, we budgeted to provide 18,500 households with income support through the Ontario Works program. We anticipate that this figure will continue to rise due to the evolving nature of the employment market and increasing population growth. As part of our broader focus on reducing poverty, we are continuing to integrate our income support benefits with Ontario Works and Peel Region's other social assistance programs for greater resident benefit, including referrals to other programs such as the Affordable Transit Program, Peel Access to Affordable Housing, Child Care Fee Subsidy, and various community agencies. We are also exploring other caseload management models to better meet the needs of our clients. This work is ongoing and evolving. The 2018 budget is forecasting an increase in Ontario Works caseloads of 1,000 to a total of 19,500. This continues the trend that has been in place in Peel since 2008. This increase is 100% funded by the province. There are no new significant investment required in 2018 other than enhancing service levels. The increase in Ontario Works caseloads, as highlighted, is fully funded by the province with no net impact to the region. The decrease in the proposed net budget is a result of taking the upload savings, which I highlighted earlier, and directing them to housing support. This slide summarizes the 2018 budget request for income support services and our 3-year outlook. Again, I highlight that there are no capital asks in the 2018 budget for this service. Employment services is next. In employment support services, we provide a range of programs for Ontario Works clients to assist them in seeking, securing, and maintaining employment. We provide tools, supports, and skill development with the ultimate goal of Ontario Works clients exiting assistance due to employment. There is no service system manager for employment. As such, there are over 32 community agencies in 41 sites and 25 Employment Ontario agencies in 45 sites and the private sector delivering some type of employment program or service in Peel. Back in 2014, we undertook a comprehensive review of the employment service landscape and determined that to be most effective, we would allow the other providers to work with clients that were job ready, and the region would focus on clients with multiple barriers to employment. Our clients require more intensive and longer periods of support to achieve favorable outcomes. In 2017, we have 1,836 clients working with employment services to seek, secure, and maintain employment. Currently, over 9% of our Ontario Works caseload has employment earnings, on average $848 per month. In 2018, we will continue to strengthen relationships with employers. We're collaborating with Ontario Works to help connect job seekers with prospective employers in Peel Region, to reduce local unemployment and to strengthen our businesses. We are also using technology to extend the impact of employment services through increased access to job boards and workshops by partnering with Employment Ontario Employment Services and the Ministry of Advanced Education and Skills Development, and extending the reach and impact of employment support services through social media, including LinkedIn and Twitter. We continue to find ways of adapting to do better. Last year in the 2017 budget request, I highlighted an upcoming employment services review in Peel. This has been done. Our proposal for systems enhancements was completed in 2017 and is currently on hold, awaiting the release of recommendations from the Provincial Review of Employment Services. We continue to utilize our community partners to deliver much more tactical skill and employment-based training programs. Hammerheads, NPower, commercial heavy equipment training, these programs are effective and focused on youth. And we are working on improving programs that assist entrepreneurs and those who choose to pursue self-employment. Finally, as a follow-up to the earlier conversation, we are in the planning stages of targeting specific programs to seniors, and with all due respect to Councillor Spovieri, we're using the age criteria of 55 plus. I don't like it either. On this slide, you can see an increase in employment funding of $1 million due to the ministry's funding formula. An increase in recoveries by community investment, which is allowing us to charge off a portion of the cost of grants that provide employment services to our Ontario Works clients to subsidy. A reduction in childcare subsidies due to the caseload mix and realignment of program costs, and the subsidy from the province for the $550,000 case management software. Through the 2018 capital budget, we are investing in case management software to better understand and address the needs of our clients and to increase efficiencies and access for job market, therefore leading to better employment outcomes. This IT system enhancement will enable us to produce customized reports to assess clients' employability and match them to our employment activities. giving us an opportunity to better target programs to subgroups such as seniors and youth, and by skill set and employability, something that is currently a challenge for us today. This slide summarizes the overall 2018 Employment Support Services budget and forecast. The 2019 forecast is a decrease from the 2018 budget due to the removal of the one-time cost for the case management software I discussed. I'll now move on to community investment. Our community investment program supports community groups to deliver a wide range of services to Peel residents. The focus is on increasing capacity and sustainability for community agencies to better meet resident needs and improve outcomes. Community investment works to assist low-income residents with programs and services that address the issues of poverty. The region launched a File Your Taxes campaign and a Get Your Benefits campaign to help low-income residents access the child tax benefit. More than 3,000 additional residents were served at our income tax clinics to ensure they receive the tax deductions and credits they are entitled to in order to maximize their incomes. 1,300 residents were provided subsidized transit at a 50% discount through the Affordable Transit Pilot Program, as approved by Regional Council on September 28th. And per the direction staff received that day, we are reviewing the program to potentially broaden it and will report back to Council in 2018. We are continuing to sustain our community investment services by providing support and resources to community nonprofit organizations serving seniors, youth, newcomers, and focusing on violence and abuse prevention. The region offers the only source of dedicated funding for nonprofit community agencies in Peel, supporting 3 funding streams: sustainability, organizational effectiveness, and collaboration. In 2018, we are requesting $150,000 in operating to support community hub development. You will recall that on October 12th, we presented our Community Hubs report. While there was support for a $150,000 stream of funding in the Community Investment Program as seed money to help agencies develop strong business cases for hubs, there was also a direction from Council that we need to do more, that we need to facilitate the development of community hubs, that we need to lead this initiative. We are currently scoping out our role and resource requirements in order to meet Council's expectations and will return early in 2018 with a Council report. We are requesting 3 staff, 2 to support our term of Council priority of reducing poverty, and 1 to support the permanent affordable transit program. We know that there is increased need to support community partners and stakeholders to advance their work and move initiatives forward. The 2 staff will directly support poverty reduction through the facilitation of external community-led initiatives, such as the Peel Poverty Reduction Strategy, Community Benefits Agreement, the Living Wage Campaign, the broader rollout of the Neighborhood Information Tool, and the follow-up on a Council direction to staff to do more to address food insecurity. And with respect to addressing food insecurity, a report will be presented to Council on November 9th, proposing the development of a Peel Food Action Council. Access to affordable transit is a serious concern for low-income residents of Peel. We are requesting a permanent staff to manage up to 1,800 participants in this program from initial eligibility approval and ongoing use. The position will also support the development of an electronic portal and will action regional council's direction to look at broadening income level eligibility, proposing a sliding scale of eligibility, and the feasibility of children under 12 traveling for free. This slide provides a summary of the 2018 net operating budget. There is a decrease from 2017 of $700,000, mainly due to ministry approval allowing us to claim Ontario Works subsidy for a portion of the organizational effectiveness and collaboration grants issued by the Community Investment Program. This is good news and reflects provincial recognition that the funding we provide under this program to community agencies has a direct impact on the well-being of Ontario Works clients. This slide summarizes the 2018 Community Investment Budget Recommendation and Forecast. You will see in our outlook years, we have included planned increases in sustainability grants for 2019 to 2021. I would now like to focus on the final service area. Child care services focuses on child care access and affordability. We help families access licensed child care that meets their needs. We also provide financial assistance to cover the costs of licensed child care for children up to 12 years of age for eligible families. In Peel, we supported 44,979 licensed child care spaces with early years and child care funding. Of the licensed child care spaces in Peel, 99% receive our support. In 2017, we received additional provincial federal funding in the amount of $21.2 million as reported to Regional Council on July 6. $13 million in new funding as part of the Provincial Child Care Expansion Plan, and $8.1 million as part of the Provincial Canada-Ontario Early Learning and Child Care Agreement. To sustain Peel Region child care services, we are increasing access and parental choice by ensuring families have fee subsidy and special needs supports. We are also improving affordability by working on a child care affordability threshold for Peel. In addition, we are providing supports to strengthen the economic viability of the sector through the provision of the Wage Enhancement Grant and operating funds. In child care services, we are adapting to do better. In 2017, we received additional provincial federal funding of $13 million, as I previously highlighted, and we are investing it so Peel residents have adequate access to safe and affordable child care. We were able to decrease the $300,000 regional contribution to the program while still maintaining a focused approach to improving child care affordability and increasing access. We were able to utilize a budgeted enhancement in provincial funding to cover base inflationary program increases, and we also found efficiencies, resulting in an overall budget decrease year over year. Our 2018 capital investment includes renovations at child care center sites and an investment to enhance the fund's management system. Specifically, $60,000 for repair and maintenance at child care facilities and $740,000 for our part of the implementation of a new funds management system that Nancy highlighted in her early years presentation. This system will better serve internal and external stakeholders and further enhance the effectiveness and efficiency of child care service delivery. This slide summarizes the overall 2018 child care budget recommendation as well as forecast for outlook years to 2021. The increase in the 2019 forecast reflects the operating impact of the funds management capital project licensing fees. This portion of the project is ineligible for provincial funding. Otherwise, you see stable increases in the forecast and no additional FTE requested. In summary, I have presented the 2018 budget for 6 service areas in human services. You will see an increase year over year shows in housing support, and that is as a result of using the Ontario Works provincial upload funding to support the Twin Pines resident transition plan, thereby ultimately leading to the future development of affordable housing. You will see service increases in Ontario Works caseloads, child care fee subsidies and special needs supports, 10 new shelter beds, additional resources to external agencies to prevent homelessness, and new staff and community investment related to the Affordable Transit Program and poverty reduction. Most enhanced service levels are being offset through much-needed provincial and federal funding subsidy. This is good news for the residents of Peel. Thank you, and I'm happy to take your questions.
Thank you, Janice. Councillor Miles.
Thank you very much, Mr. Chairman, and through you to the Commissioner of Human Services. I just want to recognize you and the staff of Human Services for the amazing job that you do each and every day in this area. I think we as a council have to recognize that this is probably one of the areas where the province hasn't let us down certainly during this term of council, that the child care reforms that we took during the last term of council and additional dollars that have come from the province of Ontario has certainly enabled us as a region to ensure that we're meeting the childcare needs of our broader population and those children in our community that need specific care due to certain vulnerabilities that they may have. So childcare is a good news story. I think in housing and homelessness as well, the province and the federal government have recognized that housing has got to become more of a priority than it has been in the past. And certainly some of the grants that they have announced and the dollars that they've announced for funding has served us well here in the region of Peel in providing more additional housing for our residents. But again, we're struggling with the province using census data from 2012. So hopefully, like was mentioned, I think by Councillor Moore, in the health budget, we need to be looking to see that the province starts to use those 2016 numbers so that we can really get a handle on housing, homelessness, and poverty. When you look at the stats and you see the amount of people that live within the region of Peel that are living in poverty, it's disheartening. So I think we as a region, we're doing more for less, which is evidenced in the reports that you have in front of you, but there's still a huge long way for us to go in order to feel confident that we're meeting the needs of a community that's growing at 47 people per day. So it's when you think of it in terms of people, it feels like an insurmountable task, but I think we are doing the things that we need to do. We're looking and building partnerships with private sector developers. In housing, we're looking for available land that we may be able to utilize to build more affordable housing. And human services staff have been right on the mark. They've been on top of these things. And I also want to recognize the good work that they're doing with Peel Living as a housing provider and in partnership with some of that work. The big area that I have of concern as well is the mental health issues. And whether or not we are even scraping the surface in dealing with individuals who have serious mental health issues and are unable to get into a system where there's not enough money and not enough housing and support. So the partnership that we've had with SHIP is really positive, but from the kinds of calls that I'm getting from the community and the responses there are so many people that are on lists that have been on lists for 10, 15, 20 years. They're now adults, and they're living in situations that none of us would consider to be healthy or positive, and they need those kinds of supports that they can only get through a housing provider that has mental health programs on site for them. So, that's, for me, it's an issue that I think we should be seriously looking at in the future, and perhaps looking at stronger partnerships and more funding allocated in that particular area.
So if I may speak to that, you mentioned the partnership with SHIP, and I just wanted to build on that. We have in Peel Living instituted a pilot project where a mental health worker is available to staff when they find themselves dealing with tenants that are somewhat challenging. And once we have evaluated that, we hope to roll that out to provide that same level of support to staff in Ontario Works and other frontline staff that have those same challenges. We are also moving to a housing first model in terms of dealing with homelessness, which will allow us to quickly get individuals housed and then build those wraparound services for them, which would include mental health.
So can I ask you a direct question in regards to that then? So if someone is on a list with SHIP for supportive housing, they would not necessarily be on our wait list for housing. So is there do the two systems overlap?
They do overlap, but it's happenstance. So if someone puts themselves on a particular list for supportive housing and on the wait list, then they're on both lists, but they are not a coordinated list.
If we have an individual that lands up in a homeless shelter with mental health issues, how do we assist those individuals in getting housing and getting support?
So council has approved a couple of programs. One specifically that I'll refer to was a rent supplement program that provides 50 housing allowances or rent supplements through the Canadian Mental Health Association, and that enables us to help homeless people find housing. We work with private landlords and we help to place them.
True. And then would the Canadian Mental Health Association actually be providing support to those individuals?
So then we would make those referrals and ensure that the individual is receiving the supports and the services that they need.
Okay, great. Thank you very much. And again, I just wanted to recognize the innovative and alternative ways that through your department, the Region of Peel is now trying to tackle some of these issues that we haven't been able to get a handle on in the past.
Okay, thank you. Councillor Moore.
Thank you, Janice, for that presentation. It's really humbling, actually, to hear both health and human services budget presentations. It's tough. I can't imagine, working in those fields. But I have a question around the minimum wage, and how nimble are we to respond to whatever fallout there might be from that, depending on, which side of the debate you are. There are those who think the sky's going to fall in, and there are those who are far more optimistic about that. But how are we preparing, or do we need to prepare for any change in the number of clients coming through the door? If you listen to the news and a lot of the employers out there are looking at ways to replace employees, and what impact is that going to have on our caseloads and our ability to respond?
So the minimum wage, I think, will be a double-edged sword for human services. In some cases, individuals that are currently employed and get that additional funding per hour, it may alleviate some of the pressure on our existing systems and services and programs. But if you believe some of the economists and what you read, it may also eliminate jobs, and those would be jobs that very much our clients would be part of. We are doing some analysis primarily in the area of childcare in terms of how the minimum wage is going to impact on the wages that they pay out to their early childhood educators. We believe that's going to have a significant impact on the expenses for licensed childcare, which could, unless we find a way to intervene, impact on the fees that are being charged.
I think it also impacts on those who are in our rent geared to income. If their income, if they lose their job, or if their income goes up. So I just put it out there.
Could be negative.
That's right, and I don't know how we predict which side things are going to fall, or whether it will sort of balance itself out, at least from a financial perspective, not perhaps from a human perspective at the end of the day. But I just put it out there because I think we all need to keep a close ear to the ground to see and be able to respond. I think we need to be nimble. Thank you.
Thank you. Councillor Medeiros.
Thank you, through the chair. I think just piggybacking on what Councillor Miles said, staff, the opportunity I've had to even go out on the field with you folks and get to really see the services and what we're doing, it's remarkable, specifically around the pressure that probably staff have been receiving, because our council has been very vocal in we've been strong advocates in terms of really supporting our most vulnerable, and that really speaks after the capacity issue and what you're really doing in terms of innovative collaboration with the service providers. The type of approach is just fantastic. I just wanted to highlight the FTEs that you added to food security the two there, and I was very pleased to see one for affordable transit. Again, you really, at the time of budgets where you put your mouth to action, and just really, it's great that we've added this, and it's really a reflection on this council and how we really want to support our most vulnerable. So just essentially the comments, thank you for the work. It's a very responsible budget, and but you do think that with the first presentation that we had in terms of setting the stage, that the pressure is only going to increase, and we have to be very mindful of that as we move forward.
Absolutely. I believe that we're going to continue to see caseload increases, specifically in the area of Ontario Works, as more people come into Peel and as more newcomers come into Canada.
Thank you. Councillor Palashi.
Thank you, Mr. Chair. I have a couple questions around the affordable housing, and I like seeing that in here you talk about how we're going to reach out to the private sector. Where was that? And just, I guess, have a discussion and open up a discussion. And I'm just wondering if we've ever looked at a way, or is one of those topics of conversation around that table going to be how we remove, how we can get people off that waiting list faster, how we can keep them off, and what programs or what programs effectively can we supply to keep them off indefinitely, not so much the list, but the subsidized.
So I'll address the latter point first, if I may, keeping people off of the centralized wait list. We do continue to pilot fairly innovative programs to look for success. One particular program I can think of is the time-limited housing allowance, where with council's approval, we have gone out to the wait list for individuals that meet a certain income threshold, and we are working with them to try to increase that employment income. I will say we have had limited success with that, but we do continue to look at programs in that area. And of course, we also do a lot of work through our Employment Services Division. In terms of getting individuals off the wait list faster, you may recall that we did a presentation earlier this year about some changes to the wait list, and council was very supportive of those changes. We may be back asking for more changes. Most of the ones that we did, so for example, minimum number of buildings have to be selected, no preferences, income, asset levels will now be taken into account. We did those on a go-forward basis and grandfathered everyone on the waiting list. As a result, they're not really having an impact on the movement of the existing people on the list. So we will most likely be back early next year saying maybe we need to tweak that a little bit more.
Okay. You know what I'd like to see before you come back early next year? I'd like to request that we reach out to anyone that is currently building affordable housing. We ask them to come and delegate to council and provide their comments and recommendations to what changes that we could do to help reduce the waiting list and benefit the people on that list.
So just to provide you some assurance, when we went through the request for proposal process, we did at the end of that process debrief with any of the contractors, builders that came forward and expressed interest to try and get some lessons learned as to why at the end of the day we didn't have more projects. And so we're trying to streamline our processes and better focus them, but I take your suggestion. Thank you.
No, and that's a great thing to do. I just don't know if that timing is the best to have that in a debrief session. I'm going to move over to childcare, and I have actually a meeting after Region today regarding some of the things, but I wanted to ask about so there are a number of developmental milestones that children go through early on in their life. And in preschool or JK and SK, I guess they call it year 1 and year 2 now. They don't even call it JK and SK. But the children have the potential to go undiagnosed until they get to a school age in ages 1, 2, and 3 before the teachers actually have an opportunity to get the support from the parents or somebody to assess the child. In York Region, they have a program called Blue Hills, where they come in, and I think it's different from our peers, where peers we have to get the parents' support, we have to have them kind of give their okay to having a child assessed. And there's a lot of pushback from that because of the lack of education or understanding of what it actually is. No parent wants their child labeled something. So it's tough in that perspective. But Blue Hills provides that kind of not necessarily going around the parents, but that opportunity to have the child assessed for potential mental health issues. Is that have we looked at Blue Hills? Is it something that we could lean more towards?
It's not something that we have specifically looked at because we do have very high caseloads through our existing Peel Inclusion Resource Services, but it's certainly a model that we can review.
Okay. That was it. Thanks, Mr. Chair.
Okay, thank you. Councillor Fonseca.
Thank you, through Mr. Chair, and thank you, Janice. Thank you very much for the presentation. I just wanted to echo what Councillor Miles has already said with regards to the region of Peel and also Peel Housing staff working diligently and so hard when it comes to finding innovative alternative service delivery models for new housing development, and all the work that has gone into with the Peel Living Board and with the regional staff on Twin Pines. Greatly appreciated by myself and the residents that currently live there. And I really think that it's an illustration that we listen and we look to local land use planning and how that connects to providing complete communities, but also it's a long-term strategy for how to make all families more successful and more resilient in the community. So I wanted to say thank you for that. I did have a couple of questions. One with regards to, you referenced youth homelessness, and our youth shelter system is having a gap, a substantial gap. Will we have a report brought back on that separate from the homelessness strategy, or is that going to be combined with the homelessness strategy?
So we are bringing a report actually to the next council meeting, which is an update on homelessness, and we're also doing a presentation to talk a little bit about what's happening at the youth shelter.
Okay, that's wonderful. And I had one other question with regards to, and this has been referenced, that both the federal government and also provincial government has seen the importance of investment in housing, but also the wraparound services that are also essential to come with housing. The federal government is set to release a national housing strategy, and there's been discussion, and it's through the Federation of Canadian Municipalities and Big City Mayors. They've released a 10-point document around the national housing strategy. One of the points or policy, one of the points that they emphasize is a realignment of the Canadian Mortgage and Housing Corporation mandate and policies with the national housing strategy, and in particular that the CMHC be used as sort of a one window for municipalities, not-for-profits, and regions to be able to access tools, programs and delivery, but also to optimize linkages between different federal funding sources. So for example, there might be funding for housing, but then also childcare may be able to be incorporated into that project, or other wraparound services. Could you, I don't know if you're able to comment right now or not on Peel's position. I guess one of the challenges for municipalities is trying to navigate, you have this access to these funds here for housing project or an idea locally, but then that would negate access to other funds, that type of thing. So I'm not sure if you can comment on that and whether or not that having those two line up between a national housing strategy and the CMHC would be beneficial to Peel or not.
So one of the frustrations or the challenges that we have often dealt with over the years is the very rigid criteria around individual programs. Although I have to say in the last couple of years, I've seen a shift by the province to allow service managers and the municipality to have much more latitude in the way in which funding is used and to be much more focused on outcomes. I'll just speak very briefly to the role of CMHC. Those of us who have been around in housing for a long time have recognized that they have been somewhat dormant or a non-player in the housing sector. But I think any new profile, any way that they can step up and provide additional tools and assistance would be welcome. I'll wait to see what the specific definition is of what their role is.
Okay, that's great. And I just want to also emphasize, I was going to mention, but Councillor Pellecci already has, just I guess the last point here on streamlining the delivery of rent supplement and continuing to build relationships with landlords, whether they be from the private sector or not-for-profit. I think it's really important in continuing to build those relationships with existing housing stock that's out there, in particular rental, because that still continues to be a big gap in the affordability continuum. So,
thank you.
Thank you.
Agreed.
Thank you. Councillor Sporvieri.
Thank you, Mr. Chairman. Thank you, Janice, for the presentation. I have a question that was actually motivated by a call I had in my office this week. People looking for assisted housing. From what I understand, they could be living anywhere in the province, and they may have their names listed in Peel and Toronto and Halton, basically in all the municipalities. Is that permitted? Because this really blows up the numbers of the backlog in all municipalities.
So I'll speak to the supportive housing piece, which I think is what you're referring to.
Right.
So we actually did have a supportive housing task force last year that looked at the system within Peel, and it is common across the province. It's very fragmented. There are individual waiting lists, and there is not enough supportive housing available. So we are working to try and streamline the way in which individuals navigate their way through the system, and we are also putting out an RFP next year for supportive housing new development. We're just waiting for some provincial funding. But it is correct. It's a very fragmented system, and similar to the centralized wait lists, which are maintained in each municipality, there's duplication and there's overcounting.
Right. So the list of backlog we have here at Peel, some of those people could be registered elsewhere, and it's just, and they could end up getting housing assisted houses somewhere else.
Absolutely, there's duplication across the province. If I chose to be, I could be on every waiting list in the province. And so if you added them all up, I'm counted numerous times as needing housing.
Right. Now,
pardon me?
Right, Mr. Chairman, we do know how many on the waiting list are not currently living in Peel.
27%.
So 27% of the people on our central waiting list do not live in Peel.
And the other question I have, the people who live in Peel, do they get any preferential treatment when it comes to where they stand on the line, on the list?
Not on the centralized wait list, no.
No, so everybody gets treated the same, doesn't matter where they come from.
We have to follow the legislation on the centralized wait list, and you can set priorities, such as victims of domestic violence, but no, there is no priority for people who live within Peel. And nor do we have the ability to set
What
that.
about a single mom with 8 kids?
No. The issue with setting a lot of priorities is eventually nobody becomes a priority. Right? If there's just so many criteria around it, eventually everyone's a priority and no one's a priority.
I see. Okay, thank you. Thank you, Mr. Chairman.
Thank you very much, Janice, for your presentation. And Jeanette, you're up, and Lorraine's on deck.
six services: accessible transportation, water supply, wastewater, waste management, land use planning, and roads and transportation. With me today is Arvind Moni, and he's the Public Works Finance Support Unit Manager. I'm going to begin with accessible transportation. The Region of Peel provides the accessible transportation service for residents who experience a barrier to using public transportation some or all of the time. We coordinate trips for clients using TransHelp buses, a variety of contracted providers, and other community partners. With our growing and aging population, the demand for this service continues to grow. On January 1st of this year, AODA legislation expanded our eligibility criteria to include individuals with cognitive disabilities. Our new applications are now 200 a month, double from last year. To maintain seamless transportation services and flexibility for our clients, we are working with our local municipalities to determine how best to leverage conventional transit when appropriate. We have invested in extended call center hours to end at midnight as opposed to 8 p.m. to offer clients more flexibility in booking their trips. We've also invested in technology to enable online applications, simplifying and expediting the application process. This new technology will also help us by capturing data and providing more business intelligence going forward to ensure efficient and effective service to our clients. We will be reopening the second site at the Mavis Road location to more cost-effectively serve our Mississauga clients. As you heard from Steve Fanton at the October 12th Council meeting, the proposed 2018 budget includes an additional 39,000 accessible transportation trips and dollars to reflect past trip growth. The 3 staff are requested to respond to the growing number of scheduled trips and increased complexity of service applications, and have inspector coverage 7 days a week to perform quality audits on the road. The total incremental operating cost of this request is $2.4 million. Overall, the proposed 2018 net operating budget for accessible transportation is $23.2 million. This includes the $2.4 million related service demand as described on the previous slide. The base budget drivers are inflation, the extension of call center hours, and operating costs related to returning to the renovated Mavis Yard. The proposed 2018 capital budget is $2.9 million, entirely funded through internal reserves. The funds are mainly for the completion of the construction of Mavis Yard and continued implementation of the Accessible Transportation Master Plan, including travel training program to help clients use conventional transit and other AODA requirements. In summary, the proposed 2018 operating budget is $23.2 million with a 3-year outlook reflecting incremental trip growth. The proposed capital budget is $2.9 million and the 10-year capital plan is $16.5 million, which includes the replacement of TransHelp buses in future years as they approach the end of their useful life. Moving on to water supply. The water service treats and distributes water to Peel residents and businesses. This year, we will produce 571 million liters of safe drinking water every day. Over the long term, this number will be driven up by population growth. However, we are also seeing a decline in per capita consumption. Annually, our staff collect and analyze over 14,000 individual water quality samples. This is an essential part of our promise to provide safe drinking water while also meeting provincial standards. Providing safe quality drinking water today means ensuring our system is sustainable in the long term. This means regular assessments of all aspects of our water system: treatment plants, transmission systems, pumping stations, and reservoirs to ensure state of good repair and minimize service disruptions. Staff, in partnership with a contractor, developed a new carbon fiber pipe repair technique to rehab the large water mains from the inside and reduce community impact when repairs are required. Not only does our recommended budget ensure we continue to provide dependable water services, but we do look to reduce costs. We are implementing a new delivery model to complete more timely utility locates at a lower per locate unit cost, a savings of $370,000. We have been successful in obtaining $75 million in federal and provincial infrastructure funding. As Peel's population grows, so does the demand on our water system and the need to expand capacity. On the operating side, we are recommending the addition of 6.5 FTE with a net cost of $294,000. 3 of those FTEs are to address automation-related projects and an audit recommendation to bring the automation, monitoring, and data management system in-house to improve security. There is no incremental cost because currently we are paying Aqua to provide this service, and the money will transfer back to us. 3 of these FTEs are required to support all public works services and employees. 1 FTE to invest in employee health and safety, both physical and mental health. 1 FTE to enable capital infrastructure projects with enhanced geographical information. 1 FTE for facility maintenance to sustain service levels with a growing number of facilities. We are requesting 3.5 contract positions for water and wastewater billing operations to address increasing call volume. These contract positions will be funded by reserves while we work on leveraging technology to become more efficient with our current service levels. And finally, Point FTE will support stormwater billings for the City of Mississauga and is fully funded by the city. As highlighted in the CFO's presentation and the presentation to Council on October 12th, we are recommending an incremental 5% infrastructure levy to sustain the capital program for state of good repair in water and wastewater. Without this increase, we will need to scale back our state of good repair projects, have limited ability to manage unexpected capital requirements, and have less flexibility to leverage provincial and federal infrastructure funding. This slide summarizes the water budget of $220.2 million that is built into the utility rate. The budget increase of $16.6 million is driven by inflationary pressures, incremental costs related to the FTE, and the 5% infrastructure levy to ensure state of good repair into the future. The 2018 recommended capital budget is $285.7 million, with half of the plan representing DC-funded growth projects and 42% for state of good repair. The growth-related projects support intensification in the Mississauga City Centre in advance of the Hurontario LRT at a cost of $39.9 million, and growth in East and Central Brampton. We have coordinated our capital plan with the local municipalities and Metrolinx. In summary, the proposed water service budget is a net expenditure of $220.2 million. The future outlook for operating expenses is consistent with inflation outside of the infrastructure levy. Capital investment for 2018 is $285.7 million, and the 10-year capital plan is $2.6 billion. These investments are needed to ensure the water system has capacity for population growth, as well as state of good repair in all aspects of our water system. And now wastewater. Peel's wastewater service treats millions of liters of wastewater every day in a safe and environmental responsible manner. This service includes the Environmental Control Program that manages environmental spills and conducts inspections to proactively prevent environmental issues. This year, we are going to treat 638 million liters of wastewater every day in our 2 treatment plants. To date this year, we've had 2 bypasses at the treatment plant. At the same time, the Ministry of Environment and Climate Change has expressed concerns with the region exceeding our 90% volume capacity rating at the GE Booth treatment plant. These risks are being addressed in the proposed operating and capital budget. Key to ensuring our wastewater system has sufficient capacity and can adapt to climate change and the more intense storms is addressing inflow and infiltration of water into our system. As presented to Council by Anthony Parente on September 28th, we have undertaken a comprehensive flow monitoring, closed-circuit television inspections, and maintenance holes inspections to identify the top 17 areas where there are increased risks for surcharges leading to basement flooding or surcharge into creeks, rivers, and lake, creating environmental damage. The inflow and infiltration reduction and mitigation strategy includes new capital construction and rehab standards, prioritizing capital improvements and diversion projects in those high-risk areas, outreach and resident programs, and ongoing monitoring and evaluation. It is a multi-year strategy. As Council will recall, the province introduced legislation to reduce the overall hydro costs by 25%. In order to qualify for the savings, we modified our operations to meet the criteria, allowing our participation in global adjustments and saving $1.8 million in electricity costs. We have been successful in obtaining $6.5 million in federal and provincial infrastructure funding. The 2018 recommended budget for wastewater focuses in 3 areas: expansion to treatment facilities to address population growth, rehabilitation of aging infrastructure, and investments to ensure our water system can adapt to the effects of climate change and protect the environment. We are proposing 3 FTE to be included in the budget to support implementation of the multi-year inflow and infiltration reduction and mitigation strategy. 1 additional FTE is requested to support the capital program for expansion and rehab in the wastewater system. And finally, while the focus over the past few years has been on the water system to meet all the requirements of the Safe Water Drinking Act, there's now a recognition that a similar quality management and compliance system is needed for wastewater to protect our environment. As a result, with the addition of 2 FTE and 1 contract position, we recommend putting in place a formalized quality and compliance program for the wastewater system. As presented in the water service, we are recommending an incremental 5% infrastructure levy to sustain the capital program. This slide provides details on the proposed $133 million net budget that is built into the utility rate. The total budget increase is $3.9 million, primarily driven by the 5% infrastructure levy, as well as inflation and the new FTE requests. The increases were offset by the $1.8 million in hydro costs. The 2018 proposed capital budget is $176.8 million, with a major focus on state of good repair projects to maintain asset service levels. Highlights of the capital projects include $30 million for major capital improvements at GE Booth Wastewater Treatment Plant, $27 million for replacement of sanitary sewers in downtown Brampton in coordination with the city's streetscaping initiative, and $24 million for local collection system repair and replacement including alignment of projects with local municipalities and our road construction projects. In summary, the recommended wastewater service budget is a net expenditure of $133 million. The future outlook for operating expenses is consistent with inflation outside of the 5% infrastructure levy. The capital investment is for 2018 is $176.8 million, and the 10-year capital plan is $1.4 billion. These investments are needed to ensure the state of good repair in our wastewater system, address inflow and infiltration, system capacity issues, and accommodate population growth. The fourth service is waste management. Peel's Waste Management Services ensures waste collection is reliable and managed in a safe and environmentally responsible way. The key focus for the program is to implement strategies and infrastructure to meet Council's 75% diversion target by 2034. Peel collects and manages over 500,000 tons of waste for approximately 446,000 residential and multi-res households. Our current diversion rate is 50%. The move to biweekly cart-based collections increased our diversion rate by 5%. To get to the 75% target, investment is needed in mixed waste processing to recover more recyclables and organics from our garbage system. The province's Waste Free Ontario Act is also going to have a substantial impact on our waste programs in the coming years. The province is moving to full producer responsibility for the Blue Box program. The Organics Action Plan under development will mean a ban of all organics from landfill. We have secured land for an anaerobic digestion facility, which will enable us to expand our organics program to include pet waste and diapers once fully operational. Through new organics contracts, we've reduced costs by $150,000 and increased program flexibility. It is also worth noting that we have reduced our greenhouse gas emissions by 30% with the collections fleet using natural gas instead of diesel. Population growth means 4,000 more households and 12,400 more tons of waste collected and processed at a cost of $1.7 million. In addition, to meet the 75% diversion target, we will need to implement mixed waste processing. $2 million is recommended for the operating budget to maintain the mixed waste processing trial while planning begins for a new facility. The increases are offset in part by increased revenues of $1.8 million from the sale of commodities. Note, however, there is some inherent risk to this revenue as a result of China's announcement to restrict the import of material from North America. The capital request supports the diversion target by investing in a review of our community recycling centers and the development of a communication and enforcement strategy. The proposed 2018 operating budget is $103.1 million for waste. The net service demand is $1.9 million, and there are base drivers of $2.9 million, primarily driven by inflationary pressures. The recommended 2018 capital budget is $14.1 million. The main drivers of this request are $5 million to initiate planning for mixed waste processing facility, $6.7 million for state of good repair, including facility and equipment maintenance, and $1.6 million for biweekly carts to meet Peel's household growth. In summary, for waste, the 2018 net operating recommended budget is $107.9 million, and the capital budget is $14.1 million. The outlook years for operating expenses is higher than inflation to account for population growth and costs related to increasing diversion rates. The 10-year capital plan is $434.3 million. The main drivers of the 10-year plan are the anaerobic digestion facility and the mixed waste processing facility. The fifth service is land use planning. The land use planning service has two main components: official plan and policies to create a healthy, sustainable community, and providing one window for developers and residents for development submissions. This year, we will review approximately 2,700 development submissions. The age-friendly planning and the health and the built environment official plan amendments were completed this year with provincial approval, and there's 3 more planned for completion next year. As outlined in the reports and presentations to Council on October 26th, the way we plan for growth has evolved. We are now undertaking a new collaborative approach to plan and actively manage growth to ensure planning priorities reflect community needs and growth concerns. We are working very closely with the local municipalities and engaging the development industry much sooner on servicing and financial implications when planning for growth. Through integrated growth planning across regional departments with the local municipalities and the development community, we reviewed a dozen detailed growth and servicing scenarios, along with the financial implications and strategies to meet the Places to Grow 2041 targets. This has resulted in a comprehensive approach to land use planning that reduced our debt by $500 million as compared to the debt that was forecasted under the previous planning and servicing approach. To support development priorities and ensure the identified debt savings are realized, we are recommending 2 FTE. The addition of a development facilitator position will support the timely development of not only large Peel projects such as Twin Pines, the Peel Manor site redevelopment, and the AD facility. It will support key projects in the local municipalities, including the University in Brampton. A second FTE will support the execution of the growth management strategy by collecting, monitoring, and analyzing data on where and when the growth is actually happening. We need to actively manage the cost-revenue gap and adjust the growth management strategy along the way in collaboration with local municipalities and the development industry. The total combined net cost of the additional resources is $100,000. The proposed net operating budget for 2018 is $3.3 million, which is less than 2% growth over 2017. This includes the cost of the additional 2 FTE being proposed, partially offset by increased revenues from aggregate royalties and reassessing base budget priorities. The proposed 2018 capital budget is $1.4 million, and this includes funding for greenland securement to protect our natural heritage features, capital projects for official plan reviews, appeals, amendments, and long-range studies. In summary, for land use planning, the recommended 2018 operating budget is $3.3 million with a 3-year outlook that is in line with inflation. The proposed capital budget is $1.4 million, and the 10-year capital plan is $12.5 million. The final service area is roads and transportation. Peel's Roads and Transportation Service aims to provide safe, reliable, and efficient movement through the region. We are focusing on managing traffic and environmentally friendly transportation options. One of our biggest priorities is to address congestion and provide active transportation options. In 2017, we will have added 16.5 kilometers of sidewalks, multi-use trails, and paved shoulders. We also have constructed 826 meters of noise walls to reduce traffic noise that impacts our residents. We are looking at how we can make the existing road network more efficient, safer, and have a smaller environmental footprint. Here are 3 examples. We have improved signal progression on 15 primary goods movement corridors. In 2016, that same type of work improved efficiency by an average of 17%. Under using new technology, we have permanent count stations to provide real-time data on the flow of traffic from vehicles and pedestrians to help inform future decisions. And we are using low-impact development strategies to infiltrate rainwater, which helps mitigate the impacts of climate change and protect against flooding. We are also saving money by investing in equipment that allows us to reuse gravel that has been washed into our ditches, reducing the costs of buying new material and disposal. We have established a working group with the local municipalities to identify collective efficiencies on our road operations. We will report to Council on the outcomes of this work in 2018. The proposed 2018 budget is $65.8 million, which is $1.2 million or 1.9% higher than the 2017 budget. The increase is all due to inflationary pressures and increased contract costs. There are no incremental service demands. The proposed 2018 capital budget is $131.2 million. Some key highlights from the budget include $55 million to widen roads and improve the intersections to accommodate growth in the community. It includes projects such as the construction of Mayfield Road from Bramalea to Airport and the Gore Road from Castlemore to Mayfield. Projects also include adding turning lanes to key intersections to improve capacity and operational efficiency. $73 million is for road construction and resurfacing of roads and structures. Examples include the reconstruction of Winston Churchill Boulevard from Terracotta Conservation Area to Old Baseline Road, and rehabilitation of several structures, including the CPR structure over Dixie Road, south of Dundas, and the bridge in Alton. In summary, the 2018 net operating budget for roads and transportation is $65.8 million, and the capital budget is $131.2 million. Forecasted increases for operating expenses are in line with inflation over the next few years. The 10-year capital plan is $1.4 billion for investment required to maintain infrastructure, road widening, implement the private noise wall conversion program, and active transportation initiatives. This slide summarizes the recommended 2018 budget for the 6 services I just presented. Thank you very much, and the leadership team and I would be pleased to take your questions.
Well, thank you very much, Jeanette. Councillor Raz.
Thank you very much, Mr. Chair. Why don't you take a glass of water and a few sips there, Jeanette?
Thank
you did
you.
a lot of talking. Wow, that's a lot of heavy lifting for the region in that section, so thank you for that. With respect to accessible transportation, the Mavis Road facility, when we were going through the process of redeveloping this site, did we look or explore other opportunities for co-location of other services at all? Or is it strictly going to be TransHealth?
No, actually, the paramedic services required a satellite station in that area, and so it is a co-locate. Okay. So there'll be a paramedic station opening up as well.
Okay, great. I didn't think I knew that. And I asked this question of ambulance as well. What is our replacement rate or schedule for the TransHealth buses?
I was actually going to add it in my presentation. It's 7 years.
That's also 7 years. All right, thank you. Moving on to water supply. There was a mention on page 5 of the actual budget documents about improving reliability of the water distribution system, specifically in Mississauga. Was that in reference to the work being done around City Centre?
Some of it is that, yeah. There's areas where there's pressure issues. We get complaints. There's also some dead-end loops, and that can create water quality issues, so we're looking at fixing those as well.
Okay. On the wastewater piece, you answered my question about the new compliance program. But you also mentioned about recent bypasses.
Yeah.
Are those the types of things that get reported back to council, or is the local councillor notified of those types of bypasses at all? And I'm just wondering if how are they gauged in the level of severity?
Yeah, so certainly, well, the ministry's notified. That's a requirement. And you do may be aware of private members bill that's looking at more public reporting of those types of situations. I do believe public health is notified, but Anthony's notifying, but have we let the councillors know? I don't know if we do. See, with water, because we have that quality and compliance program, we report annually with the issues and what. We would be implementing the same type of thing with the quality and management system on the wastewater side.
When there are bypasses, especially in the summertime, are there immediate impacts on the local beaches and
Well, first of all, just to back up a bit, when we do say bypasses, it's not a good thing. It means the plant is over capacity. But it doesn't mean like there's about 4 different levels. It doesn't mean we've skipped them all. So it still does go through some of the levels, but it doesn't bypass them all. In terms of the beach, Anthony, no. Goes out the outflow.
which is a lot
far
further out already?
But it's a sign that there's capacity issues.
Okay. Was it just, were they both related to the GE Booth site?
Yes, both GE Booth.
Okay.
When we had large storms.
Okay. On the waste section, and you briefly mentioned it as well, can you tell me more about China's announcement to restrict the mixed waste from North America and what the impact's going to be on us?
Yeah, so China takes the most recyclables of kind of mixed fiber, so all your paper and plastics. There's other markets, but because they were taking so much, a lot of our pulp plants, for example, across North America started closing down. So there's no local capacity to take them. It's a bit unsure now. We've heard from Canada Fiber that they've kind of had to start stockpiling a bit of the material. What they're doing is they're, you know, if they're going to take recyclables, they want it to be clean as possible. So they're upping the ante in terms of the contamination rate, which means if we're going to send things there, we really do have to look at our processing and how we can get the recoverable material as clean as possible. So everyone's not really sure yet what it means, but we know from talking to some of our providers, they've had to start stockpiling some of the recyclables. Now, whether some of the other markets can expand to absorb it, probably not like that, but some probably will.
Okay, interesting. No, I still have more. On the land use planning side, let me just see. I think that question was answered. For Greenland securement, are we doing this in concert with any of the conservation authorities?
Yeah, so all the Greenland securement, there's kind of a group that works together, the conservation authorities, the local municipalities, they get together and look at what are some strategic investments. So it's all laid out, and I think through a report that came to council a couple of years ago, David has delegated authority up to a certain amount, and then the others would come to council.
Okay, thank you. Thank you very much. That's it for me.
Thank you. Councillor Starr.
Okay, I have 27 questions here.
I'm going to take another glass of water.
A very simple one. The Mavis Yard, is that on time and on budget?
Okay, I'm going to look to that one. Sean, on time, on budget?
It's been delayed, Mr. Chairman, been delayed about 6 months. Primarily, it's over budget for one reason, which is contaminated soil, and that's the extra cost, about $2 million.
Was that information ever brought forward?
I'm going to wait till Sean comes to the mic. And there is a budget request. Part of the capital budget is $2 million for Mavis Road.
And through you, Mr. Chairman, that's exactly it there. We did report out for some of those costs last year at the budget process, and we're asking for the additional costs now.
So how much over budget are we
We're about
on?
$2 million over, and it's purely related.
Total?
Total. Yeah. We have a $19.7 million budget, including the $2 million I just spoke of. But $1.7 million of that comes from ambulance to fund their station. And we've run into about a $2 million issue with contaminated soil. And it's primarily gasoline. It's an old gasoline tank that was never decommissioned from the site. There's also been a little bit of contamination unknown from other uses long prior before we got the facility. And so we had, again, essentially we got a requirement whether we were building on the site or getting rid of the site, we would have had to clean that up.
Okay, great, thank you.
Thanks, Sean.
Point number 2 is we're providing 571 million liters a day of safe drinking water, and at the other end, we're processing 638 million liters a day of wastewater. For the layman's language, where's the other 67 million liters coming from?
Yeah.
Recycled beer.
So some of it's that inflow and infiltration. So some of that, the water that's getting in through the pipes that when Anthony presented, it ends up coming down to the plant and we're processing it. So it's water seeping into our system that we're processing. Is that the bulk of it, Anthony?
So that's a huge amount. That's like 12%.
I'm bringing the engineer down.
Through the chair, Councillor, part of it is related to the servicing that we provide to the City of Toronto as well. So that doesn't originate from our water treatment plants, but it is wastewater that we receive from them.
Are we being paid for that?
Absolutely.
Full cost recovery.
We have a long agreement with the City of Toronto on those services.
Would I hear over cost recovery?
Actually, in part, through the chair, part of our wastewater actually goes to the City of Toronto. We have a connection to the city at Disco Road through Malton. So we have a bilateral agreement where some of our wastewater goes to Toronto, and we receive some back. And that's strictly to leverage gravity. We don't want to have to pump. So we're working on an amendment to that agreement now. We'll be bringing that forth likely in 2018.
And my third point is waste management. We're going to have 4,000 households added. When you define a household, what is that? Is that is it anything from a single family, townhouse? What sort of requirement?
Yeah, so it could be a townhouse, it could be a single residential family. It's an estimate based on our past population growth.
So based on that, and then, so obviously 12.4 thousand tonnes of garbage, then I guess our contracts are allowing that sort of increase?
That's right. When we did the contracts with our 2 waste collection, we knew we'd have growth every year. What's interesting is we've seen quite a large tonnage increase this year, more than we expected. And, you know, some other services had, and we've speculated it could be, there was a lot of buying and selling houses before the market slowed down. So when you move, you tend to throw stuff away. So whether that was more of it. We don't know if it's related to, we had a lot of rain this year, so things get wet, where we don't have carts or in the back of the truck. So we're not estimating that increase. We're using our past averages, and we'll watch it this year to see if it changes.
And of that, I'm just wondering, because there's more and more of an impact for intensification, et cetera. As a matter of fact, I'm attending a meeting tonight of unhappy homeowners saying they don't want the bins, they don't want the carts, et cetera, et cetera. And how, you know, is there any sort of percentage, and is there any sort of lead that you're providing with the builder or developer to say this is what's going to happen, so that we don't have wherever they're taking place in Brampton and Mississauga, probably some in Caledon.
Yeah, that is.
To let them know.
That's one of our strategies. So it's going to take a lot of different strategies to get 75% diversion. And so one of the things is we're looking at our development standards to have an influence on the development, to make it easier to, you know, for people to recycle and separate organics. What's going to be interesting is, as we're starting to see more and more details of the province's strategy, when it comes to setting, banning organics and setting targets along the way, They're going to hold multi-res, like condo boards and that. They're setting targets for them and holding them accountable. We're not sure quite how they're going to do that, but there's going to be a lot more rules coming down the pipe for all the different types of housing and institutions around both recycling and organics.
Yeah, the mayor has given me a solution, but I don't want to mention it. I also think that in the strategy in the future that there should be further thought to smaller bins, smaller containers. I'm not sure. I mean, I keep getting this from a number of people. It's a huge problem, but why are we given only the 3 sizes when I only use the smallest one once a month? That sort of thing, and especially in smaller townhouses. And now even the applications we're seeing at the city of Mississauga, the units are getting smaller and smaller. And so to the point that we're hearing, well, we're only expecting 1 person to live there. And that may be multiple pickup at that particular location, but if it's a freehold, then we're picking it up.
I've certainly been out to quite a few, though, townhouse and other meetings, and certainly that's the common theme I'm hearing, particular for the green bin. They feel it's too big. Now, once we can take things like diapers and pet waste, there'll be more going in that bin. The challenge we get into, and we'd have to look at working with the contractor, is they're that size so the mechanical arms can pick them up. So it's balancing all those different issues out to try to meet the community needs and make recycling and source separating your organics easier.
Okay. I'll let somebody else speak. I have 30 more here, but...
Councilor Sprovieri. Thank you.
Thank you, Mr. Chairman, and thank you, Janet, for the presentation. I picked up some of the roads that you mentioned that were going to be on the program, but I didn't hear Mayfield Road. Did I miss it, or it's not on the list?
There's some Mayfield Road projects underway now, and then there's new ones.
In 2018?
Yep. Gary, so we're doing kind of phases of Mayfield Road. Do you want to come down and whip off the...
Yeah, so through you, Mr. Chair, there are multiple phases of Mayfield Road that'll probably keep us under construction for the next 7 or 8 years. So the project that's underway now extends from Bramalea Road to Airport Road. That's got off to a bit of a slow start, but it's actually back on schedule. The next phase will go from Airport Road to Coleraine and ultimately Coleraine connecting up to Highway 50. They're all programmed. We provided, I believe, a map with a synopsis of when all the different phases will be under construction to council several months ago, and I'd be happy to recirculate that just as a refresher. It'll give us a chance to update the timing if anything's changed. But there are multiple phases of Mayfield that are either under construction or under planning right now.
And I'm aware of that because I've been communicating, but in particular, is there any new phases on the 2018 program? Is that anything east of Airport Road? Is that section going to be underway?
So through you, Mr. Chair. So the section that'll be under construction in 2018 is the section west of Airport Road. So it'll be from Airport back to Bramalea.
But that's already in...
It's under construction now, and it'll be under construction for all of next year. As I said, I believe it's 2019, the section from Airport Road out to go east, will start construction.
Can you confirm that? Because there's a dire need for, to get that airport, to get Mayfield really, it's a truck route, as we all know. It's a major truck route that's now with Canadian Tire and in full operation there, and the CP terminal up in that area too. It's hugely used by trucks, and I'm always getting concerned about people about the truck traffic and the congestion. So if we keep that in mind, maybe fast track and perhaps get something going next year, Nate.
Gary knows. Whenever I meet with him, I ask him if the Mayfield Road projects are on schedule.
Yeah, through you, Mr. Chair, Mayfield is a real priority for us. We've been pushing it as hard as we can. There are, before you actually get into the road construction, there are properties that have to be acquired and some utilities to relocate. So it does actually take time before we can get there, but I can assure you we will expedite it as best we can.
Okay, thank you.
Thank you. Councillor Sato.
Thank you, Mr. Chairman. Jeanette, can you just give us, I couldn't find it in the presentation, on the waste management, when we went to the alternate week service, there were very specific savings, and we went to the cart-based, et cetera. How have we been doing on the annual savings with this system?
Yeah. So I'm going to get Arvin to correct me if I'm wrong. So we are achieving our savings, and that's going into reserves. Is that the money's going into reserves? So when council approved going to biweekly and sending to landfill, there was the decision made to take that savings, which was 7.5 million, but it kind of grows by inflation, put it into reserves to help fund future capital needs to get to the 75% diversion. So it is adding up. I think we're around 80, 78, I'm off by 2. So we're about at $78 million. So we're going to come to the Strategic Advisory Committee for Waste Management on the 30th with our final plan. So the budget had to come just before it, of what we think we need to do to make the 75% diversion. And once we get full approval, we'll then come back with a financing strategy for that infrastructure. And part of it will be using that 78 million that's continuing to grow. The other money that should be available is if the producers are becoming fully responsible for the Blue Box program. We're spending about $10, $12 million a year on that program that we will no longer be spending. So that tax room will be available in the long term as well.
Okay. I guess that's, you know, as residents are continuing to complain about the cart-based system, particularly those in the townhouses. And we talk about the savings, because they're saying, well, why did you ever do it? We talk about the 5 to 7 million savings, but I don't think we have ever put it into the terminology as you just have, where we have been able to save and put into reserve that amount of money. And I think that's information that if you could maybe send to us exact numbers of what we have been able to put into reserves, because I think it's important information, because they don't see their tax bill going down.
I know.
And so they're not understanding that there are savings and what's happening with those savings. So I think that's important.
So we're sure we can work with communications and come up with some nice, simple explanation.
Okay. The other question I have is, and when you mentioned that you're bringing back you're going to bring back the report on the reaching 75%. Previously, when I was on Waste Management Committee, and we did a lot of research on reducing waste, and one of the things that we had seen around the country and actually around the world was that you don't achieve your diversion rates by reducing your recycling service. And unfortunately, we ended up reducing our recycling service. So will one of the proposals or one of the costings that you are doing show what the cost would be going forward if we were to collect recycling every week and garbage every other week, what the diversion might be? Because I know there are many people who overflow their recycling bins, and on the next day after pickup or right before the pickup, because they know it's going to be 2 weeks, and if they start getting a full bin, they don't want to keep it around for 2 weeks. They're throwing it into the garbage. So I think our diversion rates could be much higher if we really promoted recycling instead of actually reducing the recycling service, which is ultimately what we did. And it never made sense to me why we did it. You know, if you want service, but we did reduce the service. So I think I would like to know what the cost would be from an operational perspective. It would, of course, reduce that $7 million annual saving, but it also might increase the diversion, which would mean that we would have savings somewhere else
Yeah.
as well.
So I can look at that with Norm. I guess the one complication would be, we could make a decision to work with our contractors to do weekly, but we're not going to be in that business that much longer, because that's what the producers are going to be responsible for.
But I thought that unless the discussion has changed, because when we discussed, I mean, this discussion of the
Yeah.
users being responsible has been going on for a long time.
Yep.
And it was my understanding, at least the information we had quite a few years ago, was that the producers are not going to be going out and collecting, setting up a whole collection system, that they would probably continue for the region, because that's why we went to the cart system.
Right.
We weren't going to throw away money by spending millions of dollars
That's
on
right.
carts, knowing that one day we would not be providing the service. So the
Yeah.
understanding was we would continue to provide the service, but the billing, the cost of that service would
Would
go
be
to the producer.
100%. from the
Exactly.
producers.
So, you know, my
We-
opinion is, if they're going to pay for it, then I would like to see recycling become a weekly pickup, and someone else is picking up the bill. So it's
Yeah.
not going to be a cost to the region at some point in time.
Yeah. There's quite a few unknowns right now.
I know there are, I know.
And we're going to, Norm will bring an update at that waste committee, because he's sitting at every possible table he can. How I understand it right now is, yes, there probably will be an option for them still to contract with municipalities to do it. The timing of when that happens, at one point they were talking about a lottery system, which seemed a bit bizarre, and they've gotten rid of that. But let's look at, when we bring that report, we'll get staff to do an analysis of what it would cost with our existing contracts to go with weekly recycling.
Well, I do think that, you know, with the province bringing in this requirement for the producers, that, I mean, they've been talking about it for over 10 years now. And I recall we did make a presentation to the province, and we said it did not make any sense to have someone else providing a service to our residents, a direct service, actually contracting it. The confusion, I mean, can you imagine if all of a sudden we go back to our residents and say, well, now, you know, we're going to pick up your garbage and your organics,
But
we're not going to pick up your blue carts that you paid for and that we told you you would be doing. I mean, the confusion that would be out there is ridiculous. And
Well,
I
and they're
thought-
going to be calling us.
Oh, they're going to be calling
Yeah.
us. I mean, the complaints aren't going to go to whoever's doing it. And I thought that the province had seen the wisdom in what we were saying, and we weren't the only municipality that was saying that. So I would hope that as staff are working on this, that they are really pushing that, because we're going to get the complaints anyway. We may as well have some control over the actual level of service and the operation. And all we really care about is that the producers are paying the bill. And that's all they should be doing, is just paying for it.
Okay,
Thank
great. We will definitely do that.
Thank you, Jeanette.
It's really hard when you're up here. You don't know if there's any more questions or it's
Yeah,
done.
you can't see the board.
Thank you very, very
All
much.
right. Welcome, Lorraine.
Good afternoon, Regional Chair. Can you hear me? No? Good afternoon, Regional Chair and members of Council. You can hear me? Okay. It's hard to tell from here. I am pleased to present the recommended 2018 budget for enterprise programs and services, as well as heritage arts and culture. With me today is Karen Koselak, Acting Manager of Financial Services for Enterprise Programs and Services. The first component of my presentation is related to the leading area focus in the region's strategic plan. The overall outcome for the services in this area is a government that is future-oriented and accountable. There are a diverse range of services contained within enterprise programs and services. You will note some key facts related to these services, including our workforce engagement at 72%, which exceeds public sector and North American norms. As well, our financial management shows positive indicators with a AAA credit rating, and we are one of 12 Canadian municipalities with such a rating. We also have high resident perception of value for tax dollars in Peel Region at 75%. The region also manages $26 billion in assets that support the delivery of a vast range of programs and services. And finally, a high volume of resident contact is managed through the Customer Contact Center through a variety of channels. To ensure internal services support achievement of service outcomes by all parts of the organization, there are a few priorities of note that will position us for the future. First, our talent management framework, which includes a new performance management program, will ensure the region has staff with the right skills to continue to meet the changing needs of residents and communities. The region is also continuing to provide comprehensive supports to promote the physical and psychological well-being of all employees. As well, a sophisticated technological environment will ensure that the region is accessible to residents and that services are delivered in a cost-effective manner. An active investment strategy will support the region's financial sustainability through a higher return on investments. And finally, the region is committed to a transparent and accountable government, which is demonstrated in part through the recent creation of a lobby registry, as well as the engagement of an integrity commissioner and lobbyist registrar. To ensure enterprise programs and services are efficient, we continually look for opportunities to reduce costs. Some examples of efficiencies that have been integrated into the 2018 budget are $122,000 net savings associated with the restructuring of real property and asset management, cost avoidance of $152,000 achieved through office space efficiencies as a result of customer contact center staff working remotely. In addition, $600,000 in savings were realized through cost analysis related to the region's self-insured benefits. This is in addition to the $2.6 million realized in the 2017 budget. The first 2018 budget recommendation for enterprise programs and services is the conversion of one financial analyst position to full-time. This position was approved by Council as a pilot commencing in 2016. The result of the pilot was the realization of savings that I just mentioned of $2.6 million commencing in 2017 and an additional $600,000, which has been integrated into the 2018 budget. The position is proposed as full-time to continue workforce-related cost analysis, thereby ensuring the ongoing effective management of workforce costs. The second budget recommendation is related to the conversion of 3 contract positions to full-time in the Customer Contact Center. In 2017, Council approved 7 contract positions. The recommendation is to convert 3 of the contract positions to full-time to manage the increase in call handling times. As noted in a previous report to Council, call handle times have increased by 43% over the last 5 years. The additional staffing resources will ensure the continuation of good customer care to Peel residents, as well as increased retention of contact center staff. The final operating recommendation for enterprise programs and services is related to public accountability. Funding is recommended to support an integrity commissioner and lobbyist registrar on an ongoing basis, totaling approximately $150,000. In addition, a further $50,000 is proposed for upgrades to the registry system. In summary, there is an overall reduction recommended in the 2018 budget for enterprise programs and services of $2 million. This is an 8.5% reduction year over year. It is also recommended that a 1% tax-supported infrastructure levy be included in the budget to ensure reserve adequacy to maintain our assets in a state of good repair. The overall increase after taking into account the 1% infrastructure levy is $8 million. With respect to capital, the total recommended investment is $33.9 million. Funding of $21.9 million will support the state of good repair of technology, largely to ensure that staff have the equipment and productivity tools to deliver on outcomes. There is also a $6.8 million investment recommended for maintaining the region's office facilities in a state of good repair. In addition, new technology investments are recommended to support the region's cash management strategy, which will yield a better return on regional investments, as well as new technology to support the effective management of $26 billion in regional assets. In summary, the 2018 budget for enterprise programs and services includes a 1% tax-supported infrastructure levy of $10 million, a reduction in operating funding of $2 million, 4 contract conversions to full-time equivalents with no new funding required, and finally, a capital investment of $33.9 million, largely to address state of good repair for technology and facilities. In future years, the 1% infrastructure levy is maintained, along with modest funding or funding reductions within enterprise programs and services. The last component of my presentation today is related to the thriving area of focus in the region's strategic plan. The presentation is in relation to the Heritage, Arts and Culture Service, or PAMA, and the engagement of residents through arts, history, and culture to improve the quality of life in our community. PAMA has evolved over the last 5 years into a dynamic environment for exploration, learning, and open discussions. It offers richness in the many exhibits and attractions for people of all ages and abilities to discover. Since 2012, there have been over 90 exhibits showcasing Peel's heritage and Canada's diversity, and almost 30,000 people are projected to visit PAMA in 2017, which is a 66% increase over 2012 levels. You will recall a recent presentation by Marty Brent on the progress that PAMA is making and how their services and programming are continually transforming based on the changing needs and expectations of the community. As she noted, PAMA has moved from a passive to experiential approach, is engaging diverse populations, and utilizing innovative approaches, including programs targeting children, at-risk youth, persons with special needs, and seniors. Several exhibits that recognize the diversity of the communities that comprise Peel, and creative approaches to engaging audiences, including co-creation experiences. PAMA's need for investments related to quality programming and marketing have been previously recognized by Council. Council approved 2 specialized staffing resources to support programming in the 2013 budget. As well, $100,000 in funding to support marketing was approved in 2011. Both were on a temporary basis. PAMA has realized positive benefits through the addition of these resources in terms of quality and innovative exhibits and services, as well as increased attendance levels. As a result, the recommendation is to build the 2 staffing resources and the original $100,000 in funding for marketing into PAMA's ongoing budget, commencing in 2018. In addition, a further contract conversion at a cost of $75,000 and supplementary funding of $75,000 to support exhibition and production costs is recommended. In summary, the recommended operating budget for PAMA is $5.9 million, which represents a net increase of $105,000 after taking into account some reductions in costs related to utilities and building maintenance charges. This represents a 1.8% increase in PAMA's operating budget over 2017 levels. With respect to the capital budget, an investment of $390,000 is recommended to ensure PAMA facilities can be maintained in a state of good repair. Specifically, the funding will support exterior lighting and roof repairs. In summary, the 2018 recommended budget for heritage, arts, and culture is a $105,000 operating increase, which represents a 1.8% increase year over year. As well, a $390,000 capital investment is recommended for state of good repair. That concludes my presentation, and I'd be happy to take any questions.
Yes, thank you very much. Councillor Miles.
I just want to say that even though this budget is probably the smallest and the shortest presentation that we've had today, we cannot undermine the importance. Undervalue.
We can't undermine it either.
Undervalue. You know, I was thinking about that word as I was, yes, okay, undervalue the importance of corporate services, because it's really the engine that drives the whole corporation. But it's also the heart and soul of the Region of Peel, because this is the department that helps to create the culture and the policies and procedures in which members of staff at the Region of Peel interact with one another and interact with our partners, which are many, many in the Region of Peel. So I'm really pleased to just recognize the great job that our Corporate Services Department does here at the Region of Peel, and support the budget that they have in front of us. And that's not to mention the historical significance of PAMA, which is an amazing facility that probably still isn't as well known as it should be, but one we share right across the Region of Peel. So thank you for all the great work.
Well, thank you. With that, you got off easy, Lorraine. See, if maybe the others should learn if they're short and sweet, then, you know.
Underline.
What's that? Okay. We're just going to just bring forward the motions, I guess. All right. I have a motion of deferral. It's moved by Councillor Yanika, seconded by Councillor Fonseca, that the report of the Commissioner of Finance and Chief Financial Officer titled 2018 Operating and Capital Budget be deferred to the November 16th, 2017 Regional Council Budget Meeting. Oh, it's a recorded vote for that.
Oh.
Motion moved by Councillor Kovac, seconded by Councillor Mahoney, that bylaw 53-2017 to confirm the proceedings of Regional Council at its budget meeting held on November 2nd, 2017, to deliberate the 2018 budget and to authorize the execution of documents in accordance with the region's bylaws relating thereto, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. All in favor? Opposed, if any? Carried. And a motion moved by Councillor Starr, second.
Go to other business?
We didn't have any other business.
I had some. You didn't announce it.
All right, what is it?
What is it? I want to get my other 27 questions answered.
Send them an email. Send them an email.
Right. No, just quickly, we all got the email about our security, and it talks about a photo identity pass and all the rest of it, and that's supposed to start next week. I don't have one. Does anybody else have one? So how do we get in if we don't have photo passes?
We better pass the budget now.
Through the chair, you should have a regional pass that gets you into the underground right now. That'd be that same pass.
So it's not a photo pass?
If you don't have a photo ID card, similar to most staff,
then your other pass will work.
Okay? You sure?
I will definitely make sure of that, yes.
Okay, well, since we're being secure now, second question is, when do we get the sidearms? Thank you.
Okay, that's the next, in 2 weeks, that budget. Okay, I have a motion moved by Mayor Thompson, second by Councillor Starr, that the November 2nd, 2017 Regional Council Budget Meeting be adjourned. All in favor? Opposed of any? Carried.
Okay, got it.